This is the first day of the summit. So today we'll be having 4 speakers. First, we have Dr. Jenny Fagel and Laura Cantu. So I'm going to be doing a brief introduction for both our speakers first. So Dr. Jenny Fagel is an internist and physician coach and life coach. She completed her undergraduate studies at Georgetown University and then proceeded to Lake Erie College of Osteopathic Medicine, graduating in 2013. And she completed her undergraduate, and she's also she runs her own page that is the Grown Up Asian, that's on Instagram. And she runs it with fellow physician and allergist, Dr. Kathleen Wang. She lives in New Jersey with her husband and 2 toddler girls. And with her will be Laura Cantu. So she is a 3rd-year medical student at the Frank H. Netter MD School of Medicine. She's currently in a rural medicine-focused longitudinal integrated clerkship program at Northern Maine Medical Center in Fort Kent, Maine. So this teaches medicine from a resource-limited perspective, and Lo also serves as a peer advocate for her classmates, providing individual and cohort-level support with the goal of developing peer support wellness. Thanks, guys, for being here.
Thank you for having us and for the warm welcome. And thank you to Christina for, putting this together. We're so appreciative. We were just chatting before while we were waiting for people to come in that, we wish something like this happened in person because then we can bring all of our Filipino food.
Yes.
Because that would be like the best conference ever. So hopefully COVID can get better and we can do that maybe in the future, which would be great. So thank you for that warm introduction. Today we're going to talk about, our presentation is entitled Hippocratic Hope, celebrating the whole person behind your medical careers and your medical degrees. And so I think I can speak for everyone when I say that the year of 2020 has been an absolute shit show. And so I think that we all need a little bit of hope in our lives, working especially in healthcare, whether you're a physician or a nurse, a physician's assistant, a respiratory therapist, we're all feeling very burnt out at this point. And I think we can all use hope. And so what we are trying to do today is to just give you some ideas on how you can, prevent and treat the burnout that you're experiencing. And so I'm going to really speak from the personal development standpoint as a life coach. And Lo is going to talk about it from more of like a systems institutional standpoint. So you can go to the next slide, Lo. There you go. So just briefly, Christina already introduced me. So I'm an internist. I live in New Jersey. I was raised in Delaware. Go Biden. He's actually my parents' neighbor. So we're really excited about that. And so I grew up in Delaware. I did my studies kind of all over the East Coast and then found myself back in Delaware for my residency in internal medicine at Christiana Care. And I stayed on there as an attending hospitalist for a few years, and then most recently as an outpatient doing primary care. And like Christina said, I am a life coach. So my story really, and my introduction to coaching began earlier this year, kind of at the height of the pandemic, when I personally was feeling very burnt out, working outpatient medicine and struggling to raise my family here with my little kids. My husband's also a physician, so dual physician household. He's a surgeon. And we were going through a lot of transition, I think, at the time. He ended up hating his job here in private practice, looking for another one. We knew where we were going to be relocating. So I sought help basically from a physician life coach, which I wasn't even aware that existed out there. But now I'm part of a consortium of physician coaches who it spans like all different subspecialties and specialties. And like Christina said, I started and co-founded the Grown Up Asian, which is life coaching for Asian women. And really at the heart of what we do is this mantra here: being a physician is important, and so is the rest of you. And you can really substitute any field really in healthcare. Like I mentioned, I think, we go through a lot and commit a lot of ourselves to be in healthcare and to serve others. And I think it's really easy to forget that there is all parts of you that should be celebrated beyond what your title is and what you give to other people. So you can go ahead to the next slide, Lo. So if you guys follow me on Instagram, I'm also at Life Reclaim, which is my business to help and coach young medical students and also young physicians. So we have physicians from all over the country send in what we call their slashes. And so here's mine on the left, all the other things about me that make me unique and things that I enjoy to do outside of medicine and healthcare. And this is Lowe's, and I love Lowe's. Balikbayan, that was like one of the first times I've heard that. I know what a Balikbayan box is, but like I didn't know that was what was described as you. You're Filipino American, you're Latina. Okay, also she was a TED Talk speaker, which is like, okay, like praise. I don't know why you're following me. Like I'm like introducing you basically as the TED Talk speaker. But she'll get into that too and her experience with that. You can go to the next slide. So what is coaching? So coaching, the philosophy of coaching really is based on the basic premise that, we need to manage our minds or our minds manage us. So we use a lot of different ways to do this: inquiry, encouragement. We really act as accountability partners. And I always say that, you're really the expert of your own life. So we really just put up a mirror to you and help you see perhaps your blind spots and things in a different way. And I put down here advising ? Because it's not really advice. Like as a true coach, you're not really telling people what to do, because that would be based on your own experience. You're the expert, your own circumstances. So it's our job to kind of tease that out and have you feel empowered to make your own decisions. And just a little plug, at the Grown Up Asian, we're actually enrolling for our December cohort right now, and it's going to be a small, intimate group of Asian women. Right now, we have a couple physicians, there's one nurse, and we're really trying to help women who feel like they've lived for everyone else's rules create their own rules. And I know, speaking to a room of Filipino women, like there's so many rules, like growing up, right? So this is your time to kind of look inward and discover your own intuition and what you want, and feel empowered to make those decisions. And so we only have a few spots left. If you guys are interested, please feel free to reach out. Okay, so your authentic self. I love this quote here by Mary Oliver. What will you do with this wild and precious life? So you can go to the next slide. What does it mean to be living authentically? It's showing up every day fully and freely as you are and how you want to express yourself. And it's really based on these domains here: self-concept, strengths, core beliefs, and core values. And we'll go through each of those. So self-concept really answers the question of, who am I? It's this overarching idea we have about who we are physically, emotionally, socially, and spiritually. And it is based on a lot of different factors, both biological and environmental. It doesn't always align with reality, so it could be congruent or incongruent, and we'll get into that in the next slide. And it can skew very much between positive and negative. So this is just one really simple example of how your self-concept can help or hinder you. So for instance, here on the left, if you have a positive self-concept about yourself, you think that you're intelligent, that's what you're thinking all the time, that you're smart. And so it just propels you to study harder and to do well in school, get academic success. So then all of a sudden you have the evidence in front of you that self-perpetuates this thought that you have, that you are intelligent. On the flip side, if you are already thinking that you're stupid or you're slow, it just kind of gives you an out and an excuse to put in little effort. And then all of a sudden, you're not trying very hard. You're not doing well and performing well. You're missing deadlines. And then that in of itself is the evidence that proves that you're stupid and slow. You can go to the next slide. Awesome. So strengths are positive individual character traits that we all possess. So they're at our very core foundation, who we are. And I think the important thing to note is that we don't really talk about what we're good at. I think especially as, I don't want to speak in general terms, or like as a monolith about Asian people, but I think in general, like especially women, we feel like it's boasting or we don't want to be braggy. And so we hide our strengths a lot. And in fact, when we give feedback or take feedback, it's always about what we need to improve upon, what we can be doing better, what's negative. And what I really liked about coaching is, you can look at things in a different way, in a positive way, and actually think about what you're just naturally strong at. And you can double down on that and leverage it and make sure that your strengths are present in your everyday life. And so this VIA strengths assessment is actually one that we use a lot in coaching, and it's free. So if you want to Google that, you can do like a 10-15-minute quiz, and you'll get emailed your strengths. And I think it's just important to have that awareness. So core values are what you find to be important and what you want to be doing with your life. And so if you go to the next slide, you'll just see an example of a lot of different values up there. And I think it's important to point out that your values are not what other people want of you. So they're not your parents' values. They're not, your husband or your boyfriend's values. It's what you truly value. And so I coach a lot of people that come to me and say that they feel unfulfilled in their life or that they lack purpose. And when we get down to the bottom of it and we try to, figure out what their core values are, they realize that their values aren't showing up, every day in their life. So, I'll talk with a physician that really values collaboration and connection and being with people, but she feels completely isolated every day. She feels the connections that she's making at work aren't substantial. And so, think about it in that way if you're struggling with something like that, with unfulfillment in your life. Go to the next slide. So like I said, these are just some benefits to clarifying your values. It definitely creates distance from any kind of pressure, not just societal pressure, but pressure that you might be experiencing from your family or your parents. It helps you to also prioritize what's important in your life. And, like I said, it improves your sense of fulfillment and purpose. Okay, so this is my daughter. This is Josie. I just chose to put her there because she just looks so innocent. Core beliefs. So our beliefs are our most deeply held assumptions about ourselves, the world, and others, and they're formed in childhood, shaped by our upbringing and experiences. And the important thing to note is they can be a source of negative self-perpetuating thoughts about ourselves. So beliefs aren't facts, and that's something that I want you guys to take away with yourself today. Especially as we're kind of rounding the corner into the holidays and we might be around people that have different beliefs than you. We've seen challenging beliefs in the media, especially with this election cycle. And people are just so firmly grounded in what they believe, but you have to question, beliefs aren't facts. It's just based on what their experiences are, what they've been exposed to, what news they digest, who they talk to on social media, those kinds of things. And I can show you on the next slide how you can challenge negative beliefs. So this is a perfect example of how experiences can form your belief system growing up. So this is totally me. This was my experience. My parents were hyper focused on very prestigious careers growing up. And my belief growing up was if I'm not a doctor, lawyer, or some sort of graduate degree career, then I was a failure. And I say this jokingly, but it's it really is true. I truly believed that for a very long time. And, did they necessarily have to say you need to become a doctor or you're a failure? No, they didn't have to say that, but I could just, you internalize what people around you say your whole lives. So you hear how they talk to, their friends that are doctors, or they hear how they talk about your cousin that went to medical school and how they praise that, but then maybe compare another cousin that didn't go to medical school and how, they talk shit about that. So that's your belief system. And beliefs aren't facts. So you can challenge that. Another common one that I think is also pretty prevalent, especially in our culture, is a focus on weight. And being skinny is equated to being beautiful. So if your experience is, your mom was obsessed, or your grandmother or whatever was obsessed with weight when you were growing up, you have this belief that, if I'm not skinny, then I'm ugly. So I'm here today to just tell you to be really critical of these thoughts that are in your mind and look at them, not like critical, like in a judging way, but just in a way that you try to challenge them, especially if they're not serving you. You can go to the next slide. So we kind of went over all this. This is just a brief little summary about, steps to finding your authentic self. We talked about leveraging your strengths. Embracing vulnerability is huge, especially in our community. I think when you're not as exposed to other people that have gone through the same struggles that we have, especially living here in the States and growing up with Filipino parents who have a completely different set of parenting, and that stays with you, right? Like your whole life. So embracing vulnerability and being able to connect with others and knowing you're not alone is really important. Letting go of should is something that we also talk about a lot, like stop shoulding all over your life. And I think it's easy to say that, in a 30-minute lecture. It's harder to implement that in your life every day. My first step would just be being aware that, am I a people pleaser? Am I seeking approval too much? Am I listening to what other people want more than I'm listening to myself and to my own wants and needs? So first step is just really bringing that to your awareness and really reflecting on that, if that's, a habit that you do. Facing your fears, aligning your values, trusting your intuition is huge. I think me speaking personally, I didn't really trust my intuition my whole life. I always sought approval, and I always, I didn't even ask myself, what do I want? It was always like, Mom and Dad, what do you think? Do you think this is good? Do you think this is good? Like, well, let's see what this person's doing. And I think that's a big step, is really just knowing who you are, what you're good at. And if you need to pivot, you pivot. And then also cultivating mindfulness, which I could talk about forever, but feel free, you can reach out to me and we can chat about that. And now here's Lo, I think. The next slide. Yes.
Yep. Thank you, Dr. Fagel, for sharing your personal story, which I know resonates with basically everyone. And I know we're not a monolith, but like we all had that Filipino childhood, and so much of that like feels. And then now I want to look at this from more of a macro perspective. So this is what we're doing as like individual Filipinas, and now what we can do as a community. So my name is Lo Cantu. My name is Laura, but I go by Lo. You can thank my nanay for that one. I was born in Angeles City, where that old Clark Air Force Base used to be. And you could see in the bottom of this picture, that's my mom. And then I call my Lola nanay, because I just copied my mom and I got really confused as a kid. So she's nanay to me. And there's my auntie, and that's me when I used to look more Asian. And there's my own baby. So like, as Dr. Fagel was saying, like we are all full people, and we are in these careers that put a lot of pressure on us to just like be medicine, like be an amazing nurse, be an around the clock doctor, like be like the best CNA who's like so attentive, but we're so much more than that. And now I want to draw on our strengths, like as Filipinas, like as a community and a network across like interprofessional teams, and how we carry this in our life. So we can go to the next one. So the first time I talked about peer support wellness publicly was last year. I did a TED Talk in Connecticut it was like titled like, how is your doctor doing? But I really feel like this applies to anybody. And it's like, it says doctor because I'm a medical student. So I have to talk from that perspective, but I know we all feel this, right? Like we are like, oh my gosh, how many times has like your auntie or your tia been like, oh, like so-and-so just got this promotion, or like just got this job, or just got into this school or in this program or whatever, right? And they're like doing so good in their career or whatever. And you feel like you need to be always amazing. Like you need to just be this like unstoppable force of good in medicine. But that's not really fair. Like we know for a fact people are burnt out, and suicide rates are high, and substance abuse is high. And the question is like, why? And how do we fix this? So it's hard, but some of that answer comes from taking off the superhero cape. Like we have to be, like Dr. Fagel said, more vulnerable with each other and more honest about what our experiences are like in medicine. And I know that's difficult, especially like at Thanksgiving or Christmas when everyone wants to brag about all of your new jobs or whatever. But saying like, this is hard. Like COVID is hard. This job is hard anyways. And then being comfortable connecting with each other about that and drawing strength from the fact that we all are sharing that type of stress. So that's sort of the backbone of peer support wellness, is like being honest about how difficult this really is, reassuring each other that it's normal to feel that way, and then allowing each other to get support, whether that's just from like each other, or like if you need to see like a mental health specialist or whatever, like that's all okay. And that's all improving you personally. And you can continue that like personal development journey that Dr. Fagel talked about. So in the time since then, I published this article in BMC Emergency Medicine, and this looks at acute care teams. So everybody, like nurses, PAs, ED techs in the emergency room setting. But I think this is true even like in primary care. When difficult cases come through the door, we have natural stress responses, and what we found was that everybody's feeling it. Like no matter what clinical role you're in or how long you've been doing it, everybody has that like, oh, gut response. And what I think is the most exciting part is that everybody said they wanted to talk about it. Like docs said they wanted to talk about it with 20 plus years of experience. Nurses who've been there for 30 years want to talk about it. So this is really like a good indicator that debriefing is something that would have high uptake. And I think that because like so many of us are Filipina in medicine, like we are so good at talking to each other. Like that is one of our strengths. We are so chit chatty. Like we are so eager to like connect and talk to each other. I really think this is something that we can bring to medicine as people who champion debriefing and peer support wellness in our institutions, like whichever aspect we need to go, whether that's going to the nurse educator and saying like, hey, I think we need to have a debriefing protocol, or like going to, if you have like a critical incident stress debriefing management program or some sort of like like sometimes quality improvement oversees the debriefing stuff, but going to them and saying, you know, the research is out there and our hospital doesn't have it. We don't have any built-in support networks. And I think we would benefit because we can be those champions because we're already really good at it. So Filipinas in medicine since the dawn of time. Those pictures like from 1912, like look at all those beautiful Filipino women. And they're learning from this surgical team, like about different surgical procedures in this picture. But more recently, we're seeing a lot of difficulty with the fact that so many of us are like, especially in nursing, the pandemic is taking a really big toll on our community. At the last conference that Dr. Fagel and I were at, someone was sharing how we got lost in the Asian skew. And like they were saying, oh, Asians are being less impacted by COVID. But when you pull out Filipinos from like the greater Asian population, no, we're doing a lot worse. And this isn't fair to our families, to us. Like, so I think that this is where peer support wellness comes in, and backing each other up and being able to unite as Filipinas and say like, we do need PPE and we all agree and we're standing strong about that. And like, we will support each other and not let people be crying alone in the bathroom, right? So from the healthcare student, that's me, perspective, this is where peer advocacy comes in and like finding your group. So this is like a screenshot from when we were doing a planning meeting for a different Filipino conference thing. But it was just, it gets so great to be in all these summits and conferences and connecting with other Filipino healthcare students. So this is my big plug for peer advocacy, which is that you like find other people who are in maybe like a similar role or year of training as you, and having that like, I know it's COVID, so like text relationship where you're like, hey, like I had this big win at work today. Like it felt so good. I totally guessed the diagnosis first, or like I totally was able to do this maneuver with the patient and it worked out well. And it's also the same person I want you to be able to text like this morning. I missed the ABG and I was like really upset about it. And I was like so stressed and like I'm wearing all this gear and I was like, I just can't do it. I'm wearing 3 pairs of gloves. And it was really hard. And like having people that you can rely on and text about those things and like be honest about how difficult it is. And also who can like cheer you on when you do eventually get that ABG. One day, not today. Okay, so in an institutional setting, if you're looking for things to recommend, to implement, ice cream rounds are research. They're a real thing and they sound funny. They're kind of like grand rounds, but they're ice cream rounds. And so what you do is, this is like a time that you, like your hospital will like block off for your group, like you know, they have to like split the nurses or split the residents or doctors or whatever by time slots, because obviously everybody can't be on at one time. But you get to be with a cohort of people and like no, you know, like over hierarchy people, like no admin or faculty, whatever is allowed to be there. And you get to just like eat sweets and you get to talk about what's going on. But we're Filipino, so we don't need ice cream because we've got halo halo. And this is like, this is your opportunity to pitch something that has research behind it and we know works, because we need to create time to support each other. Like we are not alone. That is like my biggest takeaway today, is that we are Filipina strong and like we can do these things. Plus it's an excuse to eat halo halo together, which I will never pass up on. So another strategy for improving peer support wellness, especially in the hospital setting, is debriefing. And on the left-hand column, you can see there's so many different ways to do it. So the Society of Academic Emergency Medicine, on their website, they have a bunch of different links. There's the Discern model, stress first aid, Take 10 to talk about it, info debriefing tool. Like you could Google any of these. But plug for, if you go on YouTube and search diffusing on shift, what pops up is like a 5-minute video I made on how to do diffusing. So my research mentor is an emergency department physician, and unfortunately her hospital got really hit hard with COVID, and she lost like family members and coworkers to both like suicide and COVID deaths. It's been really, really hard for her. And so this was something she really pushed me to do, was make a video that teaches people quick. It's a 5-minute video. So you can learn really quickly, like how to just have that conversation. And if you don't feel comfortable doing it with like your interprofessional team, just doing it with like your closest peers is totally fine. Hopefully though, eventually we can move towards that point where we could do it interprofessionally, because the whole care team really has value in seeing difficult cases from that like holistic perspective and being able to give feedback, because we get tunnel vision. Like hard cases gives everyone tunnel vision. Like all you see is that you like didn't get that IV, you know, all you see is that you missed something on the monitor or whatever, you know? And so having this conversation really helps people let go of like the should have, could have, would have. All of that can like really be alleviated by having a full perspective from your full team. And there are Filipinos in all the ranks. So we are here to like advocate for each other and be strong together. So salamat. Thank you for taking the time to like have this discussion. And I'm hoping you got some pearls out of this. And Dr. Fagel has like a bajillion answers for everything. So stay in touch. You can our emails are on the bottom, and then our ats are on there too if you want to connect on Insta, because I know we're all just like living in the Insta bubble.
That was such an amazing and beautiful talk. Thank you so much, Dr. Fagel.
You're welcome.
Yes, you're welcome.
And I want to like kind of piggyback on what you both said, and how, you know, when, especially with our culture, we're always so focused on our wrongs rather than our rights. And it's so easy to get caught up in what we can do to please our families. And so we kind of lose that ability to think outside of the box and to build our own independence because we want to please them. And there, you said that, you know, if you don't become a doctor because that's what your parents define as success, you end up becoming a failure, and you end up just like being frustrated with yourself if you're not able to, let's say, pass first year of medical school, and then you feel like you're a failure for the rest of your life. And that's who you are as a person.
Oh, 100%. And, you know, like I said, this is all personal experience. And I've had to talk to several of my cousins, like younger cousins, who really felt pressured to go into medicine. And, you know, I think there is a paradigm shift where you stop like blaming really like your parents, like, oh, how come you like talked like this in front of me my whole life? And it like made me feel like I had to do this. And instead you just take ownership and you realize that you can appreciate your parents for their sacrifices, but also do your own thing. And it doesn't mean that you're not valuing them. You're also but you're choosing to value yourself and what you want to do and what your intuition is. And I love like telling people, you know, if you are at a point in your life where you're trying to make a decision, whether it's like your career or your partner, your spouse, and maybe you're hearing the chit chat and the chismis from people around you, you have to ask yourself, what do you value more? Do you value, you know, like you making your own decision and maybe a temporary, point of disappointment for your parents, or do you want a lifetime of resentment? Because that's what it will end up being if you don't really listen to yourself.
Right. And sometimes you end up, like you said, you build this unresolved emotion that you have, whether it's towards your parents or yourself, and it just becomes very confusing in the long run. And then you end up feeling like miserable, like, why did I choose this path when it's not what I wanted, it's what they wanted? And then it kind of just goes back and forth. And Laura, you talked about peer support, and it's funny because a lot of us are scared to admit that we're struggling. So it's, yeah,
it's so real. Like, I feel that pressure of like, oh, like, it's so great, everything's great, but like, it's kind of, I always feel like this is always really unfair. Like, my nana would be like, oh, like, you got into that medical school, like, it's not even top 10. Yeah. But then she would turn around and tell my cousins, like, Lo just got into this medical school. I'm like, oh really, because you were just like really mean to me about it. And then it makes my cousins and I like feel competitive, like, yes. You know what I mean? Like, it builds unnecessary competition and animosity, when really it should be like us uniting, like, not against my nana, but like, you know what I mean?
Yeah, it always becomes this competition amongst, you know, your siblings, your cousins, anybody in their family, really. And you kind of, when you get together, you compare each other, you know, it's like, hey, how did that, you know, it's always a matter of like who did better. And it's never like, how can we help each other become better at what we do in life, which is, I think it's simple to do.
Yeah, I think it just is training your mind to, it's like the comparison game. Like, you root yourself in who you're serving, you know? So it's like, I'm not going to compare myself to another physician. I'm going to compare myself to a patient. Like, I'm serving a patient. I know more than this patient, unless this patient's also a doctor, then it's like, okay. But, you know, I talk about it all the time with the people that I coach. Even my husband, who's an orthopedic surgeon, it's susceptible. We're all susceptible to these feelings of comparison. Like, he'll come back from a conference where he's like speaking with other orthopods, but he feels less than the other orthopods. And I'm like, okay, but didn't you just like save someone's like limb the other day? And I think it's just so easy to just, you know, get so down and like spiral down. If you don't like control your thoughts, like, that's what happens. And so it's really being mindful of what you're thinking, and then just shifting, you know, who are you serving? You're serving your patients. That's who you're serving. So compare yourself to them.
Absolutely. And this is like the perfect time for the attendees to start typing in your questions that you have for Dr. Fagel and Laura. But there was a question that came in through the registration, and this is exactly in line with what you just said. Encouraging Filipinos to pursue higher degrees in addressing Filipino crab mentality, which is pretty common. How would you guys
wait, tell me more about the crab mentality?
Yeah, I need to hear clarification.
I want more information on this. What does this mean?
That's all the question is, though. It's
Is it mean like group think? I think that's what it is.
Oh, right? Oh no, crab. It's when they push each other down in the hot, you know, in the pot, and then the one crab steps on the other crabs to like escape.
Yes.
You know that's what it is. Like shoving each other down so that we can rise up individually.
Okay. See, we helped each other just now.
I will say though, honestly, like especially for like medical stuff, like it is not a zero-sum game. Even though I know it's so competitive to like get into these different programs, like PA programs are so hard to get into now, and like med school is so hard to get into now. But like in the world, it's not us against each other. It's not you versus me, even though it feels so competitive. It's really us versus like, let's be honest, like 900,000 white people with a bunch of money who are applying for those same exact positions. So like the crab mentality of, I'm not going to read your personal statement, or like, I'm not going to give you good feedback. That's ridiculous. Like, we should have solidarity and like be pushing each other as like these like new, there's really not that many Filipino physicians, like, let's be real. And so we should be pushing for us to have a stronger presence in medicine, because we deserve it. Like, we are smart enough, we are good enough, and we are all capable, like, that are applying, you know? And so I definitely will say, like, pushing each other to be able to overcome like the self-doubt, and then being honest with each other and saying like, oh yeah, like, let me read your personal statement. That is good. Or like, here are my suggestions, like honest suggestions. I think that will improve it. I really don't think we have to like shove someone into boiling water so we can escape the pot, because it's not zero sum. Like, we should be rallying together and saying like, all right, how are we going to strategize this and like leverage the fact that we're diverse as like a way to show people that we deserve more spots in these schools. We deserve more seats in PA school or in nursing school. Like, some of those nursing programs are insanely hard to get into, and in medical school, because like we have so many of us that like, how many of our like, you know, Lolas and Seta have had strokes, you know, and are like alone in these nursing homes or like alone in the hospital, and no one can speak Tagalog with them. And like, they don't really understand, like when they recommend low salt diets, like they don't get what we eat, like, you know? And so like, we should be rallying. It's us. We can do this.
Yeah, and I also think like the last conference we spoke at, Lo, there was the doctor, I think her name was Imelda Draconis. She's like the president and CEO of a hospital system out in California. And I think having that representation and having a seat at the table, the so-called, you know, bamboo ceiling, is so important, because then we can help, you know, our own. And really, like, it's summits like this and the other ones that we've spoken at that are so important to connect with the next generation of healthcare workers, Filipino healthcare workers, that are really going to take us through this pandemic and hopefully prevent the next one.
Yeah. Oh yeah.
Absolutely. And on the subject of crab mentality, I have a personal story to share, which is kind of just mind-blowing. I think it stems from the way we were raised and our culture in general, but I did observerships here in the US in 2018, and I had met a Filipino doctor. Obviously, I'm not going to disclose anything other than that, but when we were at a gathering, you know how Filipinos like to get together when they see fellow Filipinos, wherever you are in the world. There was a gathering. I wasn't there, but my aunt was there, and he had asked, you know, he had told my aunt and uncle that I was only here in the U.S. to find a man, and that since like I'm here in the U.S., you know how they say you're here in the U.S. and you're kind of an RK, or what they say, like a rich kid or whatever. So your only habol, or your only like goal, is to kind of find a white husband. And so, you know, and this is a physician who grew up in the Philippines, and he had come here to practice, and you know, things like that.
That is so offensive.
Yeah, he did the same thing. How is he judging you? That's ridiculous.
It's crazy, but this is just the, you know, the lengths that, you know, people will go to kind of like put you down. And I think that really has to do with the way we were raised and that level of competition, like you guys were talking about.
Yeah,
it is. I think it's unfortunate that it's like that. I've actually tried to talk to my parents a little bit about that. I think a big part of it, obviously, is like the scarcity mindset of growing up in a third world country, and seeing the United States as the land of opportunity, and you know, you don't want any opportunity to be given to someone else. So you like hide it, you like do whatever you can to just make sure and secure it for yourself. But it's a little different, you know, growing up here. And so I think that it requires, you know, openness, trying to like, you know, engage and connect with your parents for them to see where you're coming from.
Right. And I'm glad you guys are.
I can have that. Yeah. Sorry. I'm like,
I can't. Oh.
I'm glad you guys are able to have kind of two different perspectives, you know, growing up here and being able to know what it's like to be raised as a Filipino. So that provides a lot of insight for sure.
And also, like, a quick shout out, if anyone needs like a text buddy who like tells you like good job, or like I'm so sorry and that's okay, please feel free to like DM me. I can like give you my phone number or whatever. It's so important for me to have those people. And if anyone needs that, I'm here for you.
Love that. And it's okay to admit that you're struggling with something. Nobody's going to judge you, or you shouldn't feel like you're going to be judged for having a bad day, or like Laura was saying, missed an ABG. You can't expect to be perfect all the time. That's unrealistic.
Exactly.
Yeah. But yeah, so thank you so much, Dr. Fagel and Laura.
Thank you.
We had so much
fun. I can't wait to hear the other speakers.
And reach out to their email.
Yes, definitely. Please DM us anytime.
Yes. Thank you so much. So now we shall move on to our next speaker, Dr. Vania Manipod. So I see. Hi. I think we can't hear you.
Okay.
Perfect.
Can you hear me now?
Yes,
I'll
perfect.
fix my lighting. It's really dark here. Okay.
How are you?
I am doing great. This is awesome. I love all the talk about vulnerability. I
Yes.
need more of that. There we go.
I'm gonna do a quick intro, Vanya, if that's okay. And then we can start with the talk afterwards.
Sure.
Okay. So Dr. Vania Manipod is a board-certified psychiatrist currently in private practice in California. She is also an assistant clinical professor of psychiatry at Western University of Health Sciences in California. Dr. Manipod has built an international following on social media based on her work to promote the importance of mental health, particularly through her Instagram and Intermittent Fasting, which I'm sure all of you guys know of, and her blog, Periodontitis Fashion. She is a featured medical expert and contributor to various publications, and also an invited speaker on topics such as burnout, mental health, traumatic brain injury, and social media. So I will let you take the floor.
Okay. Thank you for that intro. Let me try and figure out how I can, even though I've done several of these, okay, let's see if I could share this. I'm assuming you can see that?
Yes.
Okay. Come on, how do I? Oh, there we go. Okay, so I'm going to be talking about something we need to talk about more in our Filipino culture, mental health. And again, I'm a psychiatrist, and I'm going to talk about also kind of like my journey that led me into, discussing more openly about my mental health struggles, because I'm pretty open about having struggled with depression and burnout and being in therapy, which you don't hear much from fellow Filipinos. Okay, and I know a lot of people are also interested in psychiatry, so I'm going to talk a little bit about why I decided to go into psychiatry, because I would love to encourage more Filipinos to go into the field. Okay, so first question, if I was to ask for the general public's immediate thoughts or words to describe Filipinas, what would they say? So I actually Googled it. I listed some of my own, and this plays into kind of like how we deal with mental health based on the stereotypes or perceptions of us or lack of knowledge of what being Filipino is. So some of the first things that came up was maganda, matriarch, nurse, hardworking, interracial couples, hospitable, resilient, friendly, caregivers, religious, strong, and chismis. So, I kind of thought that was interesting because I do feel like how we are perceived by the public is also kind of what we tend to project, obviously, as a culture. And I feel like that kind of hinders us in many ways because our representation is one where we're viewed purely as kind of strong, resilient, which is good, but at the same time, I feel like that prevents a lot of us from wanting to open up. So I thought it was interesting because the rates of psychological trauma and depression among Filipino American women are actually higher than those in other Asian ethnic groups. And I saw that that was also the same pattern, just in Filipinos in general compared to other Asians, such as Chinese and Japanese, is that we tend to be more prone to depression. But, some factors that might contribute to that is we do tend to be more in like the labor force, lower socioeconomic class and status, and for women, for Filipinos, they tend to take on multiple jobs while also being responsible for domestic tasks and childcare, etc. So they have to be, again, the matriarch, but then they're also hardworking. So there's really little time for self-care. Again, I mentioned we tend to be in the lower socioeconomic and employment status compared to other Asian groups, which, just historically and generally, people of lower socioeconomic status do tend to be more prone to mental illness and have mental illness. But again, they don't really seek treatment because there also aren't enough resources and there's a lot of barriers towards getting help. And also, even though we tend to be considered among other Asian ethnic groups to have higher rates of depression, we still think that's really underestimated because Filipinos tend to somaticize, meaning that we tend to, like, if we're stressed, we're not going to say, oh, I'm so anxious, oh, I'm so depressed. We're going to say maybe like, we maybe don't know how to identify it in ourselves. And we mention maybe we have headaches or we're dizzy or, or I'm fatigued. We don't really know how to verbalize and identify that maybe it's depression and anxiety. I remember one time one of my family members from the Philippines was visiting, and she kept saying that she was having this medical symptom, this physical symptom that they couldn't find no test came back like positive for anything. I was like, oh, being my normal self, like maybe you're just anxious or stressed. And I remember my mom was like, what? Don't say that. So I thought, okay, I guess I can't talk about that. Another thing to consider is I didn't actually know that the term smiling depression existed, but when I looked up Filipinos and mental health, that was a term that was used apparently often. And what that means is we have a tendency to, even though we're really depressed or not feeling that well, maybe emotionally, we still smile. And that again plays into kind of what perceptions are given off in the media. So we see things such as happy jail, which, I think was great because it really brought kind of like international recognition of the Filipino spirit, being very resilient and hopeful, spiritual, and despite hardship, still being, happy and dancing. But at the same time, I feel like that still continues to perpetuate the feeling that we can't really express that we're struggling. So things like that. And then when I actually looked up smiling Filipinos as a term on Google, what I saw was smiling Filipinos in a typhoon. And I thought, oh, wow, okay, that's how people perceive us, really, that even though hundreds of thousands of people have to evacuate from their homes and people are dying, at least we're smiling through it. So I remember like seeing coverage, and I forgot who it was, Anderson Cooper or something like that, said like, because there was video showing Filipinos during a typhoon playing basketball and happy and children smiling. And I know that that's great, but at the same time, that continues to make us feel like despite hardship, instead of like expressing it in some way, we still have to be happy, which is fine, but that also prevents us from getting help. Okay, so there's a Dr. Sanchez, who's a psychiatrist. I saw he wrote this paper, and it talked about, I tried to summarize what are some barriers towards Filipinos getting help, and he actually did this pretty good summary. And one view on mental illness amongst Filipinos that prevents us from getting help is how they perceive mental illness. So it's viewed as something to be ridiculed for, which is why a lot of Filipinos resist getting help. Again, you have to keep in mind that a lot of our identities are not just as an individual, but our identities are reflective of our family in general. So if we're getting help and we're saying we're depressed, then it looks negatively upon our family because, we don't want others to think that maybe there's something wrong with how they're being raised or that there's anything wrong in general amongst the family unit. Filipinos tend to have alternative coping measures. So we tend to prefer to seek out support from our family, which is great. That's actually very protective. Having this pretty strong family unit is actually protective against suicide, because Filipinos in general tend to have lower rates of suicide compared to other Asians. But we also, assume that we could just cure whatever we're going through by turning to family, which isn't the case many times. Also, you'll hear that, turn to religion, just pray, as many of us know, which I think is wonderful also, because there was actually a study that was done that showed that being Catholic actually was actually something that was an indicator of having lower rates of suicide as well. But again, it's not going to get necessarily at the root of our issues if we continue to struggle. Another issue is cost. We tend to prioritize other things like maybe fixing our house or, doing other things over mental health services. Because again, like as Filipinos, we tend to, want things to look, well, not generally, but because generally we want things to look great, on the outside, and take care of other family members. But when it comes to considering our own health, our own mental health, it's not really something that we think about spending that much to go to therapy. There's really limited awareness of mental health services out there. And there was actually a study that was done that showed that there was like an organization that created an educational video to show Filipino parents to identify depression in their kids and hopefully get them to seek out services. They had to really make it a type of video that was very relatable. So they showed Filipino families talking about what they saw in their children and the benefit they got from accessing mental health services and how they did that. And they did show that doing things like that encouraged them to maybe consider utilizing some of these resources. But again, I don't think there's enough education out there to promote these things. Operating hours. So a lot of Filipinos are in the labor force, so it's hard for them to take time off to go to therapy or, see a psychiatrist. And then belief systems in general, we perceive mental illness as a weakness, right? We don't want to make it seem like maybe something runs in the family because then again, that's a reflection of your family. And limitation of services. And this is a good one too, because even for me being Filipino, my previous job, I'm currently working in Orange County, California, but my previous job, I actually worked for a Filipino psychiatrist. And I had Filipino patients, but even for me, I was trying my best. I was born in North Carolina, so I don't know how to speak Tagalog. And even for me, knowing that I was Filipino because I couldn't speak Tagalog, they wanted my boss, who went to, I think he graduated from medical school in the Philippines, and he spoke Tagalog, and they said, "Oh, can I see him?" And I thought, okay, I guess even, when you have the option to see a Filipino psychiatrist, if you can't speak the language, then that's also a barrier. Okay. I thought this was pretty good. This psychiatrist, Dr. Sanchez, wrote this because I was trying to figure out also when patients didn't want to continue with me, Filipino patients didn't want to continue with me. I thought, what am I doing wrong? And then this one was good. It said, he wrote, most Filipinos are shy about divulging personal matters. They will not readily show a lack of understanding toward the illness or proposed treatment. When explaining diagnosis and treatment, the physician should not readily accept a shy expression of acknowledgement because Filipinos may claim that they understand, even when they're at a loss simply to save face, which I can understand. A lot of them would nod. I would try and say, oh, okay, I can explain it again, but then it took a lot of work and it took a lot of, attempts on my part to make sure that they felt like they can admit if they didn't understand something. So, even for me being Filipino, can you imagine if they went and saw someone of who was white or something like that, who had no idea about these types of ways to approach a patient who's Filipino? So, yeah. And embarrassment or respect may prevent them from asking relevant questions. Repeating oneself and soliciting understanding are advantageous. So again, like asking like, oh, okay, like I can explain it, but not making them feel bad if they don't understand it. So it's very tricky. And again, Filipinos, like it's family wants to be involved. So anytime I've had patients come in who are Filipino, their families are involved, and I do my best to be very respectful because I want to keep them. I want to keep them in treatment because I know that the likelihood that they will, have one visit and then maybe say that's it, or they're not getting better. I know that that tends to happen, and that happened a lot. So I would try my best to really involve the family to let them know, like, this isn't just going to help your daughter or your son, but you'll find that it'll help the family in general if you were all involved in the treatment. So again, a barrier. So I'm going to talk a little bit about my story because so I'm one of the first psychiatrists, I would say. I started my social media journey in 2010 during residency. And I'll talk a little bit more about it in the next slide. But in my social media, again, I'm open about being Filipino and being a psychiatrist and having experienced depression and being in therapy. So I didn't realize how much that would have an impact on other Asians or even other Filipinos, because I started getting messages from people saying, oh, it's so amazing to see a Filipina like talking about getting therapy. And I didn't realize like, oh, wow, like I just was trying to help, the healthcare profession or maybe physicians in general, encouraging them to get help. But I didn't realize like, oh, yeah, that's right. Like Filipinos don't get help. So I'm going to go a little bit over my story because I feel like people can identify with it in some way and might be encouraging to want to get help. So and I'm also going to reflect on why I decided to go into psychiatry. So these are all my cousins on my mom's side. I'm the oldest of 33 grandchildren. I'm right here. So being the oldest, and again, I was born in North Carolina. I have a horrible Filipino accent. My Lulu, and Lula, like especially my Lulu, he pretty much primed me to be the physician in the family. The oldest grandchild has to be a physician. And so I wanted to make him proud, but I really did not want to be a physician for the longest time. So the pressures of that, which I know many of us experience and can identify with, oftentimes gets in the way of us really wanting to explore our own identity, our own preference, what we want to be. So it wasn't until I wanted to be a newscaster. That was what I wanted to be. But I was sitting for the MCAT because throughout college, I thought, okay, I really want to be a newscaster, but I also don't want to let my family down. So I was pre-med and I took the MCAT because being a physician was my backup plan. I thought if all else fails, I'm going to be a physician. I was studying for the MCAT and I got news during break that my Lulu passed away. Makes me want to cry sometimes thinking about it. Okay. Vulnerability. It's good to show vulnerability. But it wasn't until he passed away that I was like, wow, I've been fighting being a physician all this time because of the pressure. But once that pressure was gone, I mean, I obviously had a lot of grief from losing Malulu because he was like everything to me, which is why I'm crying. But it wasn't until the pressure was gone where I recognized I actually do want to be a physician. Why was I fighting it all this time? Because of the pressure. And I know that a lot of Filipinos experience that. I think that's why I'm crying. Because I know that a lot of people experience it. I know a lot of people feel a lot of pressure. I know a lot of students feel like maybe they're not good enough to become a physician because they have to meet all these like requirements. Like you have to be like I think Laura was mentioning, you have to go to the best school or you have to get accepted at like the most prestigious program. But putting all those aside made me realize, okay, I want to be a doctor. That's going to be the best way that I can have an impact on the community. Okay, I hope that's a good example of it's okay to cry.
Jump in, Vania, and say thank you so much for sharing the story. I know it's really hard to talk about, loss, and it's a mix of like pressure, all these things, and of course, vulnerability is very hard.
Yeah, you know what? Interestingly, I've told this story many times. This is the only time I've cried. And maybe it's just because I know I'm speaking to other people who can really identify with it. I think other people identify with it too. But I know that as Filipinos, we know what it's like. Okay.
So much.
Done. Done. All right. So I went on to become a physician, basically. But as a pre-med, I never really thought about mental health at all. So I got into medical school and I thought I want to maybe I had no idea what I wanted to do. Again, I didn't decide until the last minute that I wanted to be a physician. So I had no idea about mental health. I was like, what's that? What is mental health? When I finally came down to my psychiatry block where you learn about psychiatry, I was really intrigued. And I was the type of person that really didn't go to class. But when it came to psychiatry, I actually wanted to go, even if it was 8 a.m. lecture. I was like, "Ooh, I'm really excited," because there was something about it that kind of I was intrigued by the art of it, by the fact that there isn't really much that we know about the mind. So I was very intrigued. And in medical school, I felt that I was best when I would take the time to talk to all of my patients. So even when I was on surgery rotation, my attendings would yell at me and say, "Why are you spending so much time trying to get to know your patient? They're about to go into surgery." I'm like, "I don't know. I'm just curious about their background." So I got labeled as the student who would have all the psych patients, no matter what rotation I was on. So I just thought maybe there's something here that maybe there's a reason why I enjoy it so much. So I'm going to talk a little bit more about why psychiatry at the end in a little bit. But in medical school, I actually failed it was I failed gastrointestinal neuroanatomy or something like that, and then something else. And I felt like such a failure, but I told my parents, because, we have that pressure, right, to make our parents proud also. And I've had suppressed this all this time, the fact that I was failing. But after an exam that I outright failed, and I was the only one who failed, let me tell you, that was so embarrassing. I called them, and I never did this before, but I yelled at them and I said, "I just failed and it's all because of you." You want me to be a doctor. Because again, even though I knew I wanted to be a doctor, I still felt that family pressure to be at the top of my class, which I was not. So I called them, I yelled at them. I said, "This is all your fault. I'm trying to meet family expectations and I'm just a failure." And it wasn't until that breakthrough where my parents were like, "We just want you to be happy. If you don't want to be a doctor, you don't have to." And again, not having that pressure, finally, feeling that relief made me think, "Oh, you know what? Actually, I'm going to keep going." You never know how much this pressure, to succeed based on your family, interferes with your ability to actually succeed. So once I realized, okay, I have their permission to do whatever I wanted if I failed, I realized, no, I'm not going to fail. I'm going to keep going. Again, at that point, I did not know what mental health was really, because I never thought maybe I should go to therapy. So in residency, that's when I struggled, because I moved away from family, which is one of the top reasons why Filipinos get depressed also, is because we have such a strong family unit. So when you're apart from them, it's very depressing. like, who are you as an individual? So when I moved away to residency, it was in Oregon. I was failing again. My program director said, I think you're depressed. I think there might be something going on with you. In order to graduate, you have to go to therapy. So again, I felt like a failure. And like, therapy, what the heck is that? Like, isn't that just for people who are like schizophrenic or something like that? Or, you know, like bipolar, who have bipolar disorder? I had no idea. So I told my parents that I was going to start therapy, and it wasn't that hard for me to tell them, because all I had to do was tell them, hey, in order for me to pass, I need to go to therapy. And they're like, do whatever you need to do, go to therapy. So it wasn't that hard for me to like approach the topic. So I went to therapy, and it wasn't really until then that I realized it was the best thing that could ever happen to me. For many of us who are in med school residency, we have high rates of burnout. So, you know, it wasn't really until then that I realized like more of us need to be in therapy as a profession, as Filipinos, just in general. So from there, I got way better just by getting treated, and I passed, and I was chief resident, and I continued therapy even as an attending at my first job, but that's when I got severely burned out. And that's when I openly talk about my experience. But what helped me find my voice, because I think what a lot of Filipinos struggle with is, even though we talk amongst each other, amongst our own kind, we're very loud. When placed in other situations with other people of maybe higher ranks, or maybe someone who's a peer, who's maybe white, or, you know, someone perceived to be kind of a higher status than us in some way, we tend to shrink. So I was in a group therapy program. Again, I'm open about this. I was in group therapy with a bunch of professionals. I was the only Asian. They were very loud, and I was quiet, which is how a lot of Filipinos are when we're in a group. And I remember all of the other group members saying, how come you don't talk? Why don't you talk? Why don't you talk or say something? We want to, you know, like, we'd love to hear your thoughts. And they kept pressuring me. And then one day, again, I had this breakthrough experience. One day I said, because in Filipino culture, if you speak above others, you're being disrespectful. like you're all so loud, like, you know, in Filipino culture, you get praised for being quiet, you know, don't talk amongst other people and stuff like that. And then they're like, okay, like, we had no idea. And I also told them that, you know, I was bullied also, like many of us were, because nobody knew growing up, nobody really knew what is being Filipino. So that played into it too, where I felt like I couldn't talk amongst like higher and above white people, because growing up, I was made to feel lower than them, as many of us have experienced. So group therapy allowed me to find my voice. So I decided to open up about my experience. This is the very first article that got published about my experience with depression. I was mortified when I saw the title, "A Psychiatrist is Burnt Out and Depressed. Here's what she did about it," because I thought, now my peers are going to scrutinize me, because how can a psychiatrist not even recognize that they were depressed? But by doing this, I actually got a lot of positive feedback from other healthcare professionals who said, thank you for writing this. I feel the exact same way. So that kind of started my journey with being more vocal about it, but I wouldn't have found my voice unless I was in therapy, because I had to break through the barrier that we have to be quiet, the barrier that, you know, like, if you open up about this, you are dishonoring your family. I had to break through all of those things in order to open up about it and be more vocal about things that I'm passionate about, which I know a lot of us struggle with. Okay. And then I'm going to talk again about why I went to psychiatry, because not only are there not enough Filipino physicians, there aren't enough Filipino psychiatrists. So the reason I went into psychiatry again was it was the one thing that I was really, really interested in. Psychiatry is really cool because you can have a niche. So if you wanted to say, I specialize in treating the Filipino community, then you could be like Filipino psychiatrist or something like that, and people would refer to you. And there's also different subspecialties also, like child and adolescent psychiatry, forensic psychiatry, addiction psychiatry, there's sports psychiatry. These are all things that I considered, but I'm a general adult psychiatrist because I like treating everything. I thought, which specialty can I have the biggest impact and make a difference? Again, for me, I thought that because not enough is known about psychiatry, it's not really recognized as something that is, what do you call it? Like, there's no test for it. There's an art to it. And I also found that if people's medical issues were not improving, there might be a psychological component to it that I could address. So I kind of thought my goal would be for people to realize, like, unless we address psychiatric issues, there's a lot of people whose health is not going to improve because psychological issues can be a barrier. My personality, for many of us, like we come from big families. For me being the oldest, I thought, like, I want to be a part of something that, where, being the oldest, like, I can make a difference, I guess, like kind of be somebody who can make a difference in the field. My grades and scores, and I'll be honest, like my grades, when they say C equals MD, 7.0 equals DO, that was me. I was like, my scores were not that good. My grades was enough to pass. I didn't think like, oh, I'm going to get into plastic surgery or anything like that. And that was okay because I didn't want to go into those fields anyway. But I was being realistic. I'm not saying that it should hinder you in any way from trying, but, I was being realistic. Like, I didn't really want to go into those fields anyway. Again, don't want to discourage you, but I just thought like I could make another impact in this field anyway. So it kind of worked out for me. Lifestyle, yes, being a psychiatrist, you don't have to have as much call depending on which environment you choose to work. I choose not to take call. So because I hated call my first few years as an attending, so I don't take call. And I see patients 3 days a week. Again, I was burned out and I found out what works for me. Money is at the bottom. I think a lot of people, especially med students, think I need to be a plastic surgeon or something, or, orthopedic surgeon or something that makes a ton of money. But in positive psychology, which is basically research that explores what makes people happy, money is nowhere near there. So money should not be a factor in deciding what field to go into or what specialty to go into, because like really when it comes down to it, like you could have a job, like you could choose a specialty that makes the most money, but if you're not passionate about it, if it's not something that you wake up every day really excited about, you're not going to be happy. Okay. And then Dr. Christina, there was some questions that you sent me. Do you want me to go over them, or are you just going to list them?
Oh, I can listen.
Or I could go over it, because actually one of the questions was really good because it ties into it, and that was breaking the stigma of mental health among Filipinos and how to encourage Filipinos to seek mental health services. So I actually wanted to address that because it obviously ties into what I was talking about. The way we break stigma is by doing things like what Dr. Christina has, accomplished with this summit. It's by getting people to openly talk about their mental health struggles getting people to openly talk about being vulnerable, and doing what I was doing by openly talking about depression. I didn't recognize the impact that it would have on the Filipino community. I was just doing it because I felt it was the right thing to do. But I've gotten a lot of emails from Filipino Americans saying, because of you, I decided to go to therapy. And I thought, oh my gosh, because we don't really see, again, what we see in the media is happy jail and smiling Filipinos despite disaster. If we show like, look, you could still be all those things, hopeful, resilient, grateful, but still go to therapy to improve yourself and still be successful, and not look down upon for getting help, then we need to see more of that to encourage people in the Filipino community that it's okay. So we're doing exactly what we need to do. It's kind of slow, but I would like to see more openly talking about their experiences.
Is it okay for me to jump in?
Yeah, of course. Feel free.
Because this question is really important. Lately, fortunately, like in the Philippines, we're slowly starting to talk openly about mental health. So one physician back home who champions for mental health is Dr. Gia Sison. And
I follow her on Twitter.
Right. And she's a mental health advocate. And we rarely see physicians encourage, which is funny because we're in healthcare. But when it comes to us seeking healthcare for our mental health, we kind of shy away from it. And we're like, no, I don't want to be like stereotyped into be like, that's for crazy people. You know what I mean? It's like, unfortunately, that's the mindset that we have about it. And going a little bit more personal is when I moved here last year, like you said, who are we without our families, right? And so I struggled with that so much because everyone in my family is back home. And so I came here alone. Usually when IMGs come here, they have, family, they live with them, or they have like friends of family, things like that. Some kind of like bridge that makes you feel like you're not alone. But when I came here, I was like, okay, I'm gonna like feed my independence. Let's do this. And something, of course, my mom at first wasn't 100% on board with. And so I came here and I just went through such a long period of struggling with like depression, anxiety, all these things. And I didn't know how to cope with it. And I was struggling and I was thinking to myself, this is so strange. Like, I'm in medicine. I should know how to deal with this. I'm not supposed to be feeling this way. What's wrong with me? And this isn't the first time I've experienced depression, but you don't think about it at first. You don't say to yourself, oh, I'm going through depression. Or you think to yourself, I'm not supposed to be feeling this way. I have a home. I have a family that supports me. I have all these things. I don't have the right to feel this way. Or I'm in America. Anybody would die to like be in my position right now. I don't have the right to feel anxious. I'm blessed beyond belief. Those are all, like incorrect ways of kind of dealing with our emotions as Filipinos, because we're not allowed to struggle. Like you said, it's all like, you need to be happy all the time. We are a happy culture. I'll say that. That is still true. But we're also allowed to be human. And and what you showed earlier, an expression of vulnerability. It's okay. Like, it doesn't mean you're weak. But so we're slowly opening up to the idea of being more vulnerable, being more open, and being more in touch with our feelings back home. It's going to take a while. It's going to be a slow process, but I think we're starting to get like the ball rolling a little bit. But that was my the only thing I wanted.
Thank you so much for sharing. I don't know if you've opened up about that a lot before, but that like actually is very validating. See, and that's exactly what I feel needs to happen. Like even you just sharing made me feel like, oh, I'm not alone. Even though I know I'm not alone, it's like we have to hear it. Like, it's not enough to just know like, oh, like there's another person, like there's another Filipino like opening up about it. Like, we have to hear it. and feel connected with it. So thank you for sharing.
So well, thank you for sharing.
That's funny because actually Dr. Gia Saizon, I started following her a while ago. And one of the first things when I saw her being so vocal, I was like, oh my gosh, like we need to see more women like Filipinas doing that in these types of positions.
Exactly.
Yes. Okay. So yeah, going back to what we can do to break the stigma is doing exactly that, being open and talking about it and encouraging others to go to therapy by sharing our own experiences. But we also need to see more Filipinos in the mental health field. So I think more are wanting to join. Interestingly, several years ago, I reached out to the Philippine Psychiatric Association. This was a while ago, and I didn't get a response. I don't know how active they are now, but there is a Filipino psychiatrist in America, and I was thinking about joining it. So, you know, anything that we can do to maybe promote others to go into the field would be great.
Please keep me updated. I would want to promote something like that.
What was that?
Please keep me updated if you get a response.
Yeah. Yeah. Well, that was like in the Philippines, but then there is the Philippine Psychiatric Association. Right. So yeah. Okay. In America. Okay. The next question. Can I just go over these, Christina?
Yeah, of course. Okay.
The next question was how to deal with stress while having online classes. That's a great question. That is very hard. You have to be very intentional. You have to be very organized because you don't have kind of that group type of feeling where you feel like you see other people kind of studying and stuff like that around you or going to class. You have to be organized on your own. But I think the most important thing is kind of creating a space that's very conducive to learning. So I know I've seen like some of my patients, they're doing online classes right now, and then they're like studying. They tell me that they're studying in bed. I'm like, no, like that doesn't really work that way. You need to create a space that is kind of, I guess, like is going to promote you wanting to actually stay there and study like you were in class. So that's one of the things. But I think the most important thing is allowing yourself to take breaks. So I feel like just students in general, especially people who go into the medical field, they kind of sit there for hours studying. But there's a lot of research out there that shows that if you take breaks, you're actually more productive in the long run. So I always encourage people, no matter where you like, what, you know, part of your career you're in, whether you're a student, whether you're in practice, you have to take breaks. So that's pretty much like I would say the number one thing. And also breathe, because I know when people are, you know, at their desk and they feel really pressured, like they have a lot of catching up to do and stuff like that, they don't breathe. So that's part of allowing yourself to just kind of like cope with the anxiety at the very core is breathing. So breathe, breaks. Okay. How was your experience in residency and in your practice being a minority woman physician in psychiatry? So in residency, here's my picture of my residency. Oops, what did I do? I don't even know if you can see it, but that was the very first residency class. So I was part of a completely new program. I was the very first to graduate from my program. Again, I think that's reflective of my personality, being the oldest of 33 grandchildren. I was like, I'm the first to graduate. But I'm the only Asian. Well, actually, Dr. Nagaraj right here, he's Indian. But you know, I being a Filipina in Oregon, where there aren't very many of you, I remember people asking and saying like, what kind of Asian are you? You don't look like you're Chinese. But yeah, I remember having to explain that. And then I would have patients when I was working on the inpatient unit. You know, I don't fault them at all, but you know, when some of them are psychotic, some of their inhibitions are gone. So they say whatever comes to mind. So I remember getting hit on a lot because I think there's this perspective that, you're the submissive kind of like Oriental flower Asian. So I got hit on a lot by older white male patients. So that was part of my experience. But I wasn't, because I worked with, I had mentors and attendings who saw a lot of potential in me. Again, even though I felt like a failure being told you have to go to therapy in order to graduate, they saw a lot of potential in me. They wouldn't have told me to go to therapy unless they thought it was going to strengthen me as a person, which it did. So I feel like if you have mentors who see, your potential, no matter, being a minority woman or, whatever, like, you can really do like whatever you want. And it's unfortunate because I get a lot of messages from minority women, especially Black women, physicians in their programs where they feel very suppressed, oppressed. And one of the most important things to look for in a program is one where you feel very supported, no matter what. So I was very fortunate. My program director, he really encouraged me to be chief resident. So I feel like my experience in general was very positive, aside from, the stereotypes that you'll get every now and then for being an Asian woman physician. And how to manage transference when working with patients. So countertransference is the response that, I want to make sure we're good with time. Okay, we are. Countertransference is the response that we as a physician-clinician get when we interact with patients. So for example, if I'm working with a Filipina, an older Filipina patient, my countertransference might be, oh, like they're kind of like my Lula, like that's what I experience when I'm working with them. Whereas transference is what the patient experiences in response to you. So for a lot of patients, their transference might be like, oh, you're a higher, in a position of power. So I feel less than you or something like that. So whatever response they have. This is very tricky. This is something that's learned over time. But what I found to be most helpful was having really good supervisors. In my residency program, my attending physicians and my psychotherapy supervisors, they would actually watch all of my sessions via video. So I don't know if that's how it is at other psychiatry programs, but they saw all of my session. And then when I processed it with them, they would say, what did you experience when the patient said that? Or what was your feeling, the feeling that you got in regards to your patient? So they really helped me process it. So when I get a certain feeling when I'm interacting with a patient, I utilize that as information. So if I'm feeling anxious when I'm interacting with patients, I am feeling their anxiety. So I utilize that as information saying, okay, I need to do something to help them feel more calm, or I really need to assess and address the severity of their anxiety because I feel it too. So other people around them must experience it as well. So again, that's why psychiatry residency is 4 years. It takes a long time to develop that ability to utilize it as information, because oftentimes what we experience from our patients is not based on labs or what they tell you. It's about what you feel in response to them and being able to transform that as part of your formulation of your patient. Okay, that's it for that.
Thank you so much, Dr. Vania. Oh, did you want to plug and mention?
It's all on there.
But yeah.
If there's any more questions, I'm fine with answering. I just wanted to put that.
Yeah, I was just gonna say, because you mentioned during your talk earlier how Filipinos, they think that being quiet is a good thing. Guys, now is your chance to ask Dr. Manipod all your questions, and not encouraging being quiet in this Zoom event. So please go ahead and if you want to speak up or type a question on the into the chat box, please feel free to do so.
I'm also understanding, you know, like sometimes it takes some time to kind of, you know, like ask a question. So I encourage a lot of people to email me as well, you know, because so that too. Feel free to message me if you have any questions also.
Yes.
Hey, hey, Vania, it's Jenny.
Hi.
I just wanted to quickly, you know, say thank you for sharing your story. I completely related to every single part, including when you called your parents and like blamed them for making you become a doctor. I also had that fight with mine.
Yes, you have to.
Yes, that's just what we do, right?
That makes me feel better.
Nice. Yes, and it's so nice to meet you finally. I was telling Christina that we've just been DMing here back and forth, but in this COVID world where we're making friends through Instagram.
I know, so cool to meet you. I'm excited for collaborating in the future.
Yes, for sure. No, I loved your story and keep showing the vulnerability. That's what we all need to hear right now.
Oh, thank you.
Hey guys, hey girls, hey Vania.
Oh, hi.
Hi. Good morning.
Good morning.
So does anybody else have any other questions for Dr. Vania? Feel free to jump in at any point in time. If you're too shy to ask it now, all of Dr. Vania Manipod's contact information is on this screen. But yeah. If nobody else has any questions, thank you so much again, Dr. Vania, for sharing and for that excellent talk that you just did. I really appreciate you taking the time to be here as well.
Okay, thank you for having me. Bye, everyone.
Bye.
Stop share, okay.
Okay, so our next speaker is Dr. Melissa Mondala. I hope I'm saying that right. Please correct me if I'm wrong.
Yeah, that's right.
Nice to meet you. It's so funny. We're all meeting for the first time.
Yes. It's a pleasure to be here. Sorry if I came in a bit too earlier. I was just trying to test the audio.
Yeah, so I was just going to do a quick intro and then we can go ahead with your talk if that's okay.
Yeah, thank you.
Okay. So Dr. Mondala is a Southern California native and a board-certified family medicine physician. She has accelerated the lifestyle medicine movement within academic institutions, social media, community fairs, and podcasts. She is a uniquely engaging motivational speaker that brings evidence-based methods to combat chronic disease and uplifts potential barriers through self-empowerment and self-compassion. The floor is yours.
Okay, well, good morning, everyone connecting virtually through different time zones. It's so glad to be amongst Pinayhood, right? It's so interesting because the background story is, yes, I was born in California, and my family, they're born and raised in the Philippines, and in their, they speak the languages, and I probably understand and speak very little, but I do identify as myself as Filipino. But when you grow up and you try to assimilate in so many different cultures and find your identity, and I think with being a Pinay has I think the older I got, the more I understand not just the importance, but how uniquely different we are. And sometimes people either point that out, or they, we always hear the good side, like we're hospitable, we're friendly, we love food, and like that's kind of like the commonality between all of us. And it's interesting because that's kind of the nice fit for, if you think about it, for healthcare, because it's you're really trying to connect with people, easy to really relate and start conversation. And because we are, I would say, our history and heritage, we always had to overcome barriers, no matter what upbringing you maybe, or where you started with, I think that that's the commonality, and the resilience is strong throughout generations. So I think it's just an honor to kind of to be here and share a little bit of my story. It's a long one, but I know the focus is the nutrition and the intermittent fasting, which I'll go into. But just the background story is that, you know, with the different types of opportunity out there, I think that healthcare has always been the, you know, females. There's all these, I would say, even stereotypes that we hear over and over again, and, you know, we're the caregivers. But I actually started back in college, the Filipinos in health sciences. So like later on found that this is something that's still a need. That was like 15 years ago, and still right now in 2020, there's still a need for more female I would say health providers, physicians, dentists, you know, whatever it is, we need that for the community. And so thank you for bringing this together and bringing all of us together. So let me just share screen so that you can see my PowerPoint. 1 second here. What can you see? Can you see the screen yet?
Yes, I can see it.
Okay. All right. We'll start from the beginning. Okay. So day in the life of what I do is basically I'm family medicine trained at Loma Linda, and then did a lifestyle medicine fellowship. And, you know, I people ask me, do you always wanted to be a doctor? And really, you know, that was something I did want, but I didn't know necessarily how to become it, or what it really entailed until you start trying and trying and trying and trying. It's not an easy route. There's times where you may not so because of the complexity, there are times where, you know, I didn't necessarily get in the first time. There are times where, you know, I didn't get into a California school. Like you definitely have to be a little bit more open-minded and stretch yourself. And I think this pathway has not only stretched me as a person, but in a good way. Really rebuilding as you're stretched is the key. So this is kind of my transformation, my story, and my husband. And so this was us during medical school, because we were just stress eating all the time. It's a stressful career in a way where you're studying 24/7. You know, you think about college and all that you learn, but jam pack it all in like one semester. You know, it's high, it's fast paced, it's a lot of knowledge that you're trying to basically memorize and apply and go. You're and I think in that environment you're really challenged. And so what we did during our path is we just ate a lot. We were, you know, we're foodies at heart, and, you know, Filipino culture, even Asians, we love food. Our culture is centered around food. It's part of the fun, it's part of the pleasure, but also some people even do this because they're bored, or because they're trying to cope with stress, depression, anxiety. And you know, the more you do it, you don't realize that your body becomes really inflamed and unhealthy, and your mood is altered. And so we found that that can actually happen really fast. Some people think, you know, did the weight gradually come on? Yeah, maybe in about 6 months to a year. People, you talk to patients, you're like, when did you gain weight? And some people will always say, not just pregnancy, but it was that stressful time, that traumatic time in my life, I just overate. And so when it comes to lifestyle medicine, I always try to understand the why of, you know, why are people unhealthy? Why do you have those symptoms? Where does it come from? What's the root cause? And so I discovered those. I was curious about nutrition, and, you know, when I say lifestyle, it wasn't necessarily a term that you hear in medical school. It's actually only been around since 2004. So it wasn't mainstream, but, you know, I still valued that there's something else going on. Besides knowing that there's a medication and there's a disease, and that's it, because people were still getting sick, people were still dying at an early age. And so as you can see, this is like our 10-year challenge, and I gained like, I don't know, almost 15 plus pounds. And that might not seem like a lot, but for me it was because, you know, petite little, I was always pretty active. I was in some type of like, you know, extracurriculars, cheerleading. So for me, it was a lot, and it was what affected me was more of my guts. So I got IBS. My husband, he has his story. He ended up with gout, pseudo-gout, ankylosing spondylitis, which is all autoimmune because he just had high protein diets, mainly processed food, standard American diet. So eventually we found what I'm going to be talking about, and we lost the weight. But more than that, we really regained the quality of life and our purpose of what we do. So I kind of already told you kind of what my background is. I finishing up primary care psychiatry through UCI and practiced at Loma Linda. I'm going to be finishing that off. I did inpatient, outpatient, worked in pretty much we call it FQHCs because they're really patients below the poverty line. And so that's kind of what a piece of me. That's why I practice globally and just volunteer there, because it's still, I think, giving back is kind of what I do, just like this, right? You give back, you make time because you know that you couldn't be here without someone giving back to you. And then I'm doing private practice now. So how many has anyone heard of lifestyle or lifestyle medicine? You can nod or raise your hand or just give me a smile behind the scenes. But there's a difference between lifestyle and lifestyle medicine. You know, there's on social media, you hear lifestyle like, oh, that's for maybe your fashion, or that's your health and wellness. Maybe it's your relaxation, your work-life balance. But lifestyle medicine is really finding that medicine, the healing portion comes from how you live, your daily habits, and what you do to eat or move, and even what you also how you deal with stress and what toxins and substances you're taking. So the big picture is with lifestyle medicine is here, which is founded in 2004, is based on your relationship. So how are you able to maintain healthy, positive relationships while having quality sleep that's restorative, like you're not exhausted, even though you sleep a certain amount of time, and you're not when we say napping, you're not taking naps throughout the day, and in fatigue constantly. And basically trying to avoid tobacco use, because it's still, the studies are still strong. It's the #1 cause of lung cancer, and still people struggle with it. So we help with patients who have those type of, I would say, dependence and even other types of addictions. And we definitely help with nutritional counseling and education, specifically with whole food plant-based. And then really going into how do we just keep moving, because our society is all sedentary, meaning we're always on our butts sitting. And that's just the culture that we kind of felt in a place where our society's definitely progressed and it's become more industrialized, but our movements are very limited. And so we definitely need to focus on our movement on a daily basis, and then managing stress once again. And that's just key. We know this is hard during COVID times, and we know that this is how, stress will always be there, but how do we perceive that kitty cat as a cute and like touchable, rather than a lion that we have to run away from constantly, and we're sweating and we can't even function. So all these things are together, we call it multifactorial. They all overlap, and they actually start creating chronic disease. And chronic disease is basically diseases that you see over months, years, in a lifetime. And so this is, I know, an older slide, but this is just a nicely put, I would say, summary of lifestyle medicine. And we see that it's basically helps as therapeutic treatment. So most of these chronic diseases like depression and I'm sorry, I was jumping ahead. I meant to say heart disease and diabetes and high blood pressure, high cholesterol. These are typically lifestyle driven. So it's usually because of these unhealthy behaviors that create these chronic disease. So we get to take a step back and see how we can use lifestyle as first line treatment, but also potential to manage it better and maybe even reverse them. And when I say reverse, that means I see it most with diabetes, hypertension, high cholesterol. There are other cases when patients follow this strictly and they're able to reverse them too. And, there's larger and smaller studies how to, I would say, support that. I won't go into the details, but those are the ones I see. And then what happens when you go to medical school, in case you're wondering, did I learn about nutrition during medical school? And the answer is no, not really. If anything, I learned a lot about diagnosis, pathophysiology, disease states, and then also drugs. There's a lot of medications. I think this is 35 hours. This was an older study of just learning the pharmaceutical drugs and 168 drugs. So it's probably now double the amount of drugs that we have to learn. And then on nutrition, they try to study this and look back at what was actually provided in curriculum. And they say an estimate of 2 hours. I've seen they say 19 hours, but really if you ask our generation of doctors and even older generations, they probably just only remember them learning BMI, like basically your body index mass or body mass index to really understand how that correlates to disease. So I would say, not as practical. Of course, we know BMI is important. We know that alcohol, it does increase your risk for certain disease, but not the actual what is in food. How can that help my body? How can that actually potentially destroy or poison our body? So there's different, I would say, mechanisms of how nutrition can be taught. And we, as physicians, we tend to actually understand that our referral basis is important. So that's going to be our dietitians. We tend to just kind of let them be the leaders in that. And we realize that sometimes that's actually not enough, and that patients really have a lot of questions about diet, and it takes them a while to even get to the referral for dietitian. So we have to start earlier and younger. These are some of the body, what happens to populations, or even, what's in your food. And so these caught my eye. And then in the end of the day, after I realized, there's not just because there's cool documentaries and all these doctors that all agree on this, but I saw it within myself and I tried it out with my patients, that lifestyle medicine was something that I wanted to keep doing because I wanted to save them from side effects. I wanted to save them from having to inject their insulin every single day. And, with diabetes, even though they're taking their medications, they're still getting CKD, chronic kidney disease, early heart attacks, strokes. And most of the time, patients about 60% don't take their medications correctly. So that's a high amount of patients who aren't treated properly. And so that's why the education and counseling are really important. And I always give the choice. You want to, there's chances for healthy, red, beautiful food that's one of the choices here. And then, or just constantly taking your insulin and checking it. And it's honestly not the best quality of life. People are not so happy when they're on medications, especially when we think about diabetes. It usually comes in a metabolic syndrome, which is diabetes with high cholesterol, with high blood pressure and obesity. And then usually they also come with depression, anxiety, and then wait 5-10 years, they'll have a stroke and a heart attack. So it's kind of, I just saw the revolving door that just kept repeating itself. And so that's why, where does it come from? So this is the standard American diet. This is, if Michael was here, he would say he was eating like basically all of this every day, all day. And so that's why he got really sick. And so you'll see that these are the things that, I'm sorry. So this is basically on the top. You see a lot of processed foods, sugary foods, salty foods, dairy products, man-made foods. So foods that was manufactured and with tons of additives. And So the reason why this all matters is because it increases our risk for disease. The clearest, and I would say, link is with colon cancer with processed red meats. And so that's your pepperoni, your salami, your deli meats. They really have high amounts of nitrates and carcinogens that are linked to cancer. And the WHO, which is the World Health Organization, is making that big stance and saying that that's the huge risk. And so that's why colon cancer is actually being pushed from. And when I talked about screening, such as a colonoscopy, they recommend it at age 45 now instead of 50. So that's 5 full years like that. They're trying to catch it earlier because there's just more and more people getting colon cancer. So just imagine your family, and think about how many people with cancer, and it's actually becoming more, I would say, common and more to the point where it's becoming closer to their family. It's not just like an aunt and uncle. Sometimes it's sadly a parent or a sibling, and it's usually because of generations of lifestyle habits. So you may wonder why I think and like this, and it's not just a thought, it's actually the science behind it. And so here's all the ingredients that is in the standard American diet. But maybe you can think about it. I should have made a slide for standard Filipino diet, right? We have lots of lechon, we have all crispy patas, and tons of we love our eggs on everything too, and and there's fish too, and I'll go into the details of what that looks like. But I would say most, if we think about this 20th century, most of them are animal centered rather than the plant centric. Plant centric means, if we think about our ancestors, they probably ate a lot of more fruits and vegetables, beans and nuts and seeds, because that's what they grew, that's what they could afford. Now everything is easier, faster, and because it's all industrialized, it's at our fingertips. We can get it next. We can drive just a few minutes and we get food, and we don't have to necessarily hunt for it, prepare it, and even preserve it. So animal products, we can find saturated fat there. These are fatty acids that really raises our cholesterol. And so that is also supported by the American Heart Association, American Cardiology Association, that we really need to limit saturated fat to 5 to 6%. And actually, most of Americans probably triple that amount on a day-to-day. And so we overconsume saturated fat in all those animal products. And I put coconut and palm oil too, because those are the ones now responsible for LDL, increasing our LDL. So we have to be careful not to overdo it on the coconut, because Filipinos love coconut. I do too, and so we kind of soak everything in our coconut, but we have to just limit that. So 5 to 6% is what we need for a healthy heart. And healthy heart is not just someone who had a heart attack, but I always think of, let's talk about prevention, right? So we don't want to get to that point where, oh my goodness, I have chest pain now. I'm going to go from 50% down to 5 to 6% total calories of saturated fat. You want to get ahead of the game. And so here is another one. What else is in animal products? So there's something called zoonotic diseases, and now COVID is a good example of it. There's salmonella, there's other types of, I would say, bacteria that you find within animal products, either in the egg, the dairy, or chicken is most common. And what's hard is because these animals are constantly being treated by antibiotics, because they're in cages, they're in a small space, and they are very prone to infections because they have, I know this is gruesome, but they have they have their feces and everything all around them, and they're just, that's not how it was before, but now even more so. That's just how they are mass producing these types of foods. So they're really getting high amounts of antibiotics, and really that's why they're really, if you look at some of the studies, that's actually goes, not, we're consuming them as Americans, and then we really are more prone to receiving these types of viruses and bacteria, but also we're less likely to actually less likely to take in the antibiotic as if it was our first time. So wouldn't work as well for us compared to years and years ago. And these are other things. There's also things that really in the animal products that are pro-inflammatory, they're carcinogenic. You'll see these are medical biochemical terms, but basically when you have your animal products, you're going to be having something which is called insulin growth factor. And that is a big one because that drives up the human, I would say, cell growth, and you're constantly replicating it really fast. And you always want that in check because when you have inflammation, you want to make sure that that's not spewing all this cell cancer proliferation and turning it into a tumor or cancer. Heme iron is also something that is really found in animal products that increases colon cancer. We call it heart disease, atherosclerosis, and then it increases our risk for diabetes. And then this is another term, nuke 5GC. It's just really all these components. I'll go back and forth. They're the ones responsible for inflammation, and TMAO is also a new one that we are studying and showing that all these interact when you consume dairy and animal products. It goes into your gut flora and really just spews out more pro-inflammatory food or pro-inflammatory reactions that go to your liver, to your entire body, to your brain, all your kidney, just everywhere it go into a place where it's trackable, meaning now they're having more studies to show is it just meat or is it chicken, is it fish? And so we're trying to understand what it really does in our body, and which stroke, heart attack, and even decrease amount of years in someone's life. Here's another important thing. So salt and sugar are pretty much the same in my eyes because they all really, I would say, imagine inflammation. It's like, so I just to kind of give you a visual aspect of this, which I give to my patients, it's like little fires, little flames. And that's what inflammation is. When you think of a foreign body, you get a little splinter and you can get infection and you have pus and it just gets inflamed. When you think about food, it goes into your gut, and then when it doesn't like it and it's not nutritious, it starts to get inflamed, it builds fires, and then it tells everything in your body that danger, this is something we need to either we need to calm down or remove from our body. So the salt and sugar are high pro-inflammatory foods. Instead, we have something called phytonutrients. So this is the colors of the rainbow. And really, if you think about it, it's each one has so beta carotenes are in your orange, like foods like carrots, but every single color gives the amount of diversity and gives the amount of healing products. And these are anti-inflammatory foods, anti-cancer foods. When I say anti, it's really the things that can decrease your risk for these diseases. And what's in this that animal products don't have is that they have fiber. So lots of good fiber. How many of you counted fiber on your food label? And you can think about it. Most of the time we go straight to the calories. Sometimes we look at the salt and sugar. I would always say look at the ingredients. The less it has, the better, because if it has 50 of them, you probably don't recognize it. It's probably are additive and processed too much. But the thing to look for is fiber. And so most of the time people get, I would say 25 milligrams is the minimal recommendation. There are studies that say people just get fiber 10, maybe 95% of people actually get the required amount of fiber in the US. So we're really lacking our fiber. And so try to hit 25 grams of fiber. And you can do this in easily as one meal or throughout the day. And spices are really, really good too. They are anti-inflammatory. You'll see all these yummy ones. I wish they had some more Filipino ones on here. I would say we all like black pepper. there's other ones maybe we're not used to using, right, in our culture, like turmeric, rosemary. Those are all kind of new, but I would venture to say try it out. Try to add a little bit at a time, because they really help with inflammation, and be creative there. And so what's the evidence behind all of this? If you're curious, usually we look at big, large studies. It's hard to look at, we call them random control studies, double blind. Basically, it's a fancy term where you try to control everything and really measure if one thing really works against the placebo. It's hard to do that in nutrition. There are a few out there, but the larger studies allows us to look back from a big population for years and years and years and see what the rates of disease are. And so the Adventist Health Study 2 is basically a large study, and they use the US, Canada, not just Loma Linda, which is where I trained, but they looked at their health for at least 22 weeks, which is a long study. Sometimes you hear studies of just 1 month. The longer it is, so this was only almost 2 years, so that's pretty decent. And so here, the plant-based vegans or Adventists, they actually consume more fruits and vegetables, consume less saturated fat. They ate foods with less low glycemic index, such as beans, legumes, and nuts, watched less television, and slept more hours at night. What happened? So they basically lived longer. They were less obese. They had a basically normal BMI, normal weight, low LDL, low rates of high blood pressure, lower rates of diabetes, and lower rates of colon cancer specifically. And you'll see the list of studies that also replicate this. And so at the end of the day, the takeaway message for all of this is, I really want to empower everyone who goes into healthcare is to take care of yourself first. You are your, I would say, best advocate for yourself. We tend to give to the point where we kind of unfortunately stress out, suffer, and then we don't have much. Our cup is really empty and we're dry, and we can actually feed ourselves and our soul positive food and positive thoughts when we really focus on our lifestyle, when we prioritize ourselves, when we make healthy boundaries, when we exercise. I would say when I started moving and making it a routine, I felt so good. I had more focus when I studied. My mood was better. I wasn't as grumpy. I wasn't as impatient, because I felt like, oh, I feel good about myself. I'm eating good. I'm happier. This food is like, my acne was getting better. So many things it was helping me, my husband, and family patients. So more and more, I think when you invest in yourself first, you just make a better health professional, a better doctor, and you are better with your time, because if you're able to manage your health, you're probably better at managing your lifestyle, your practice, your time. And so just let it overflow, and continue to ask those hard questions, like, why am I doing this? What does it mean to me? What's my motivation? Where do I want to go? I think this allows you to stay motivated, inspired, and even confident when things are rough. So I would say focus on yourself, and then things will line up. And then fasting. I know there was a request that I talk about fasting, so I'll cover it briefly here. And so fasting is basically when we put our body at rest, and this is practiced for, I would say, centuries in different cultures, and now it's becoming more modernized, so they have different names for it. But the science behind it is basically when we give our body a break, we allow ourselves to not just reset, but we develop ketones. Usually when we eat, we consume glucose, carbohydrates. Those are like the top two, and fat, and 3. So those are called macronutrients, those 3. When we give ourselves a break and we're not eating, we're basically allowing our body to break down glucose first, and then fats. Fats is what basically converts to ketones in the liver. And the ketones in itself, these are the things that improve mood. They induce this type of state to help treat seizures back in the day, like epilepsy, the severe seizures, and that really help them. Now they're trying to study it with many diseases, like chronic disease, even not just diabetes, but traumatic brain injury. We see it a lot with weight loss, right? So many different methods they're trying to test it, but also apply it to patients. Of course, there's the keto diet, right? But there's different ways of doing these, I would say, fasting, right? There's the fasting by not eating, taking a break, and sometimes they call it restricted, but I like to say just taking a break on eating. Other people do it by also thinking about the refeeding component by adding more fat in, either plant-based or animal fats, and that will accelerate the development of ketones. And so what it does to the body is it fuels our brain and cells during the fasting period. So the ketones actually cross the blood-brain barrier. And that's why people feel a peak in either their energy, their mood, concentration. And it really is an anti-aging. It regulates the mTOR pathway, and that's basically helps for better skin, and your repair mechanisms are more active. So when things are damaged, they're actually, when you fast, they hype into hyper mode. So they're able to move faster, repair faster. And that's why I say reset and give everything a break, so it can focus on repair. So repairing, helping with aging, helping with activating those pathways that really, because if we think about it, when I talked about the inflammation, right, and we're constantly eating carbs or I would say even protein, all those things, those are the things that wear out our body and our cell functions. And so fasting allows it to take a break. During the refeeding period, it's basically very, very important. So I've been to places where they fasted, I fasted for 3 days. If you're curious, right, try that. I did 3 days of water fast. I've seen people who fasted for a month, but they're under close supervision, or even longer. There's those 90-day fasters out there. But this really has to be done. I would say, disclaimer, you really need to, this is for educational purposes, you need to really get a health professional, a physician, to really understand your medical history and if this is safe for you. So please don't try this at home until you see a doctor. Like I said, I just want to share the science. There are different types of fasting. There's prolonged, intermittent, and alternative fasting, and 5-2 fasting and circadian fasting. So the prolonged fasting is what I mentioned, which is days, weeks, months. Intermittent fasting is basically giving yourself a break, not eating 16 to 18 hours, eating twice a day, and no snacks in between. Water basically is what you need. Alternate fasting is when you probably do it every other day in your week. 5-2 is people who do fasting 5 days a week, like maybe Monday through Friday, and then weekend they're not fasting. Circadian fasting is basically those who go with the sunlight. It may differ if you're in a different, I would say, daylight savings, but basically you eat only when the sun is out, and you can range that anywhere from 8 to 12 hours of your fast. So basically, some people, the goal of fasting is to really, I practice this once in a while too, is to not only allow yourself to repair, but also kind of, with food, we all have this dependent nature. We know we constantly eat, right? We're snackers. We do it because we enjoy it. It's a behavior, just like when people smoke. It's just, you don't even know it. I can eat like a bag of popcorn, right? So like the fasting allows us to take a break, kind of separate our dependence from food, and really refocus onto some other type of activity. And in the beginning, most of the time, you're going to feel hunger. And I would say I experience extreme hunger, like meaning I really know what the definition of hunger is now, right? Because sometimes you think hungry is just a growl and you're like, oh my gosh, am I hypoglycemic? Which is not really the term of what really hunger is. Yes, you can have low sugars, but when your body really needs that, I would say food and substance to the point of survival is true hunger. You're a little bit, yes, more irritable in the beginning, obviously, because you're probably craving like crazy, and then reduced ability to concentrate. So in the beginning, you're just not going to be as focused. I remember studying for my boards during that time, and I in the beginning, you're kind of slower, but on the next slide, you'll see the other side of the fasting benefits. But they will usually appear in the beginning, like if you do it for a day, it just happens in the beginning. If you do it for a week of intermittent fasting, it happens the first few times. And like I said, make sure you do your research and talk to a doctor. The benefits are, we know that this is it is a faster way of weight loss. It improves your blood sugar tremendously to the point where people need to get off their diabetic medications because they're not actually taking in the same amount of food and even, I don't like to count calories, but it's like a combination of those things. And so that's why sugar improves tremendously. I do it with my patients. I monitor their sugar, their blood pressure, their heart rate. You would see the benefits quite dramatically. All their cholesterol improves. And I see this happen fast. People are like, oh, does it take years or months? And literally you can see benefits in a month. Even with a plant-based diet, you can see it in a month to 2 weeks. Depending how much you're doing it, all these things happen really, really fast if you make those changes. And so here's another one. So decreased risk of cancer growth. So this is being studied in breast, ovarian, prostate, endometrial, colorectal cancers. And really, when I say support cognitive function, because when you fast, after the first day, you actually get a boost in energy and focus. Like you actually don't need as much sleep anymore because you're able to use all that ketones that fuels your brain. And so you have better focus. So that's kind of the nice thing I experienced when I fasted after that. So second or third day, that's when I got the benefits. So this is just a conclusion. I could talk for hours, literally, or days on these topics. But I wanted to just give you a hint of something you can consider in your career. Lifestyle medicine is being practiced all the way from a physician level to other health professionals, so nurses, PAs, I would say health coaches, PTs. Everyone is actually becoming part of the American College of Lifestyle Medicine, to the point where when I say everyone, I'm sorry, that's biased, but I mean, like, it doesn't matter what background you may have. And so it's nice, it's interdisciplinary, different disciplines and specialties even. So it's not just a primary care doctor, but other doctors are coming together to really try to understand lifestyle medicine and start to teach it and practice it with their patients. And so, like I said, the biggest experiment I say is just with yourself and you can see what works for you. And I say, what are the pearls? Move often, be mindful, be present always, and understand that the stress will be there, but literally taking time out for yourself that are activity. Like I was just in nature, sometimes you see nature, sometimes it's calling a friend, but fine, do it often, don't wait last minute, because that is your medicine. So reach out to people, stay connected, find your tribe, find a mentor. Obviously, we're all here, your speakers. If you ever need advice, I'll share my information and tips. Is you want to find someone who can guide you. I think that's important. Protect your sleep, sleep well, because that's part of like the fasting, like example, if you're not sleeping, you're probably eating. So sleeping and fasting work hand in hand. And then this is a bit more about me. So at Dr. Lifestyle, we just launched that, starting private practice. It's a new adventure. It's a lot of time, but all worth it. And if you can just, if you want to learn more about us, my husband, here's our social media handles, our website. We're on YouTube and other platforms, but I would say we're happy to help. And as a Filipina and anyone you know who needs support, let us know. We're here to guide you.
Thank you so much, Dr. Melissa. That was such an amazing talk, and thank you for sharing your story. I think it's so easy as, people in healthcare to forget to take care of ourselves because we're so busy taking care of other people. And not just like your mental health, but your nutrition, what you put in your body. And I think the phrase, you are what you eat, reflects very heavily on, how it affects our day to day, like with intermittent fasting. I think it's also such a great way to, since I'm preparing for step 1 right now, I'm trying to practice I am doing IF, and it's helped me better with brain fog and with my focus. Because I've had like moments where when I overload on sugar and carbs and fried food with saturated fats, that's when I feel really sluggish. I kind of lose focus, concentration, and then I'm not really able to perform or study efficiently. So I love that you just did this talk because it's something very, very important, very necessary. Thank you so much for sharing. We have 2 questions for you, if that's okay.
Sure.
I'm going to put it in the chat just so everybody gets
I see it. Is it what is the difference between lifestyle medicine and preventive medicine?
Oh, I think that's a private question.
Oh,
go ahead.
I can answer that real quick.
Sorry, yes.
So there's lifestyle, there's preventative, there's integrative, there's functional, there's a tons of different fields of medicine. The difference between lifestyle and preventative medicine is actually a residency, and there's different combinations where first you do that 1 or 2 years implemented into a family medicine residency. Sometimes you can do it separate, and they have their own boards. They also focus on population medicine, so that's more statistics, epidemiology, working in the county. For example, at Loma Linda now they have addiction in there, occupational medicine, aviation. It's like a really cool field too. I have a colleague of mine who went to work for the CDC, and so it's pretty neat. I would say and there's a lifestyle medicine is probably just like a little portion of it. Lifestyle medicine is more focused on the pillars, which I explained before, like nutrition, exercise, sleep. Preventive medicine is a large scope, but some people do both. Some people do, I would say, with lifestyle medicine. Now there's a board for it, and there's a fellowship at Loma Linda where I did. Now there's about 4 or 5 more pilots to be coming up, and then they're trying to do a virtual one too. So there's by the time maybe you're applying, it's going to look a lot different, but it's definitely something that you can keep asking questions on.
All right, and we have another question from Laura. She's actually one of our panelists. How do you handle that hangry feeling on shift when doing IF? I get snappy when hungry, and I don't want to accidentally snap at a patient or attending. I can I feel this.
I know, right? You're like, oh my gosh, like you feel like, oh, I'm shaking or I'm so hungry. Literally what I do, like a mixture of water and citrus is really awesome. So getting like orange or lemon, I put that in there. You can put some mint. So you can definitely find ways to curb your appetite, and making sure you have your 2 to 3 liters of water per day will curb your cravings too. So that's one way I do it. Or sometimes I just go for like a slow walk, slow 5-minute walk, 2-minute walk, whatever you have time to do, right? And then because it's easy when you have like candy all around you during the holidays, or you go to the break room, oh my gosh, donuts, hide. So I understand that. I typically just carry my own healthy snacks, or make sure I actually eat a lot. Mike eats all the time, and so it's hard for him to fast because he eats like throughout the day, but they're all like healthy meals, or like options, like a whole half of watermelon, like that's like he can eat that, and like 5 oranges. I'm a type of person who eats just loads up on, like I love like yam, or like the Filipino, there's variation Asian ones, right? So even the Japanese yam, sweet potato yam, I just always have those things that fill me up. And everyone has different taste buds and cravings, but you'll see your taste buds will change. In your gut, you'll feel less bloated. You'll feel your pants and everything will just feel loose and comfortable because your body's not as inflamed anymore. So it'll take time, but it's possible. Anything else?
So Maria is asking, what do you think is needed from the healthcare system to incorporate this type of approach?
Oh, sure. Thanks, Maria, for that question. Yes, from the healthcare system. So, we're doing a pretty decent job, and we're now understanding prevention is important. I think the healthcare system is, you always have to think of insurances, and you also have to think about the overall health, the policies, right? So there's some bureaucracies and logistics that you may not know until you actually are an attending and you work for a big system out there and they tell you only have like 20 minutes of time, or you have to bill a certain way. And so I think the key is for our healthcare systems and that it's reimbursable, so that they're willing to spend money on it and be also willing to invest in it, in time and funding. Most of the time, preventive lifestyle medicine, to be honest, it's to some people, they think it's super basic, but as you know, there's a lot of that I showed in this lecture, that there's not just studies, but there's a method to it. And so I think more and more it's getting a lot better, I would say, but that sometimes you just have to be creative. Like I'm doing private practice, right? So you practice in and outside of the system, and the ACLM is really good at going even to Capitol Hill and asking for change there. So more down, bottom up, different layers. Even unfortunately, they only have less than $1 to fund their meals per day, and so of course it's going to be less quality foods. So there's so much work to be done, obviously, but I think that more and more we have people that are aware and willing to try to start to make a difference. Sorry, I'll answer that. How to promote a plant-based whole food to kids? Good question. And you'll see that it's so possible, like vegan parents raising vegan kids, or plant-based parents raising all their kids on that types of food, and there's plant-based pediatricians. So I don't think now we know it's not only possible, but how do we do it, right? How do we promote it? It's really by modeling, like really showing them, oh, I enjoy it. Because usually if someone in the family says, oh, this is disgusting, make a face, they're probably going to copy you and say, yeah, I don't like that, I don't want it. So modeling, leading by example is number one. Number two is don't assume that they don't like it forever. So if they don't like it today, they might actually like it next week. So if it's you're trying to introduce them to I would say beans or something, kids are they fluctuate in their mood and in their attention span. So don't give up, be persistent, in a positive, healthy way, make it fun, involve them when you cook, involve them when you're grocery shopping. Any other questions?
I guess the one last question is, how do you overcome challenges involving career and life transitions, especially now, and thrive as a minority in healthcare?
Oh, thank you. Yeah, great question. So I think when you're dealing with challenges, you'll learn when you're in medicine, there's always going to be a challenge. There's challenges with your healthcare system, your team, your patients, everywhere you go, there's just challenges. Sometimes it may be very directly towards the system, which usually it's never one person at fault. I don't like to blame anyone. It's usually the system and the biases within the system, the culture. And so really we have an opportunity to just keep pivoting, keep evolving and being resilient, because to me, I don't know. I don't really see them too much as a challenge being a minority, to be honest. And I'm thankful and blessed by that, because I feel like I've had other lows in life. Like if it was my own self experiencing IBS, depression, anxiety, I know when I'm healthy, I feel like I can overcome a lot of things. When I'm not healthy, that means I'm struggling with battling these day-to-day, if it's racial things or conflict at work. So I kind of just try to reflect and think about what I can do to do better. And so I think now it's not as a challenge anymore. Thank God, because we're in 2020. If it was 80s, back, it probably, my parents did experience racism. And so it was a challenge for them. So I think just consistently reminding myself of how far we've come, and how every day opportunity, API Health Virtual Summit, it's coming up, and we have some of the people on this panel will be there too, is really trying to create the counterpoint argument to these hard challenges. Is we do it by educating, we do it by empowering, and just sharing these real, genuine stories that need to be heard. And I'm sure all of you have your stories, and I always want to know what they are. So shoot me a message, tell me who you are, and I'll get to know you.
Thank you so much, Dr. Melissa. I really appreciate you taking the time to join us today. If you guys want to contact or reach out to Dr. Melissa, on the screen you'll find all her handles and her website, drlifestyle.org. So yeah, thank you again so much for being here.
Yeah, thank you. My pleasure. Have a great day.
Thank you. All right. So our final speaker for today, for day one, is Dr. Bianca Velayo.
Hi, is my audio on?
Yes, it's on. We can hear you. So nice to meet you.
Nice to meet you, Christina. Thank you for having me.
Of course. So I'm just going to do a quick intro of you, and then we can go ahead with the talk.
Cool.
Okay, awesome. So Dr. Bianca Velayo is a 2015 graduate of Tufts University School of Dental Medicine and the owner of Green Valley Smiles Dentistry, a PDS supported practice in Henderson, Nevada. Dr. Velayo is passionate about educating her patients on their dental conditions and empowering them to take control of their oral health. This inspired her to create Oral Health Minute, an educational and entertaining video series. So you can go ahead and watch them on her Instagram page at dr.bianca.velayo. So the floor is yours, Dr. Bianca.
Hello, everyone. Thank you for having me. So I'm really excited to be here. And let me see if I can get started with sharing my screen. All right, here we go. Cool. All right, so the subject of my talk today, we're going to be talking about periodontal disease and how it affects us as Asian Americans, Asian population. So a little bit about me. I'm a general dentist. I'm a first American Filipina doctor, and I've been practicing dentistry for 5 years, as Christina mentioned, and I own my own dental practice. I'm married. I have a 1.5-year-old little boy, and so it's great. I love and I really love being a general dentist. And so moving on, the problem, what brings us here today? Almost 50% of every American adult has some form of periodontal disease, okay? And in that same report, according to the CDC, more than 50% of Asian Americans have periodontal disease. Okay, so this is a subject that we, not just as dentists, but all healthcare providers, aspiring healthcare providers, and just, being Asian should be aware of, because this severely impacts our demographic, our group, our families. So what is periodontal disease? Alrighty. So periodontal disease, everyone knows what gingivitis is or have heard of it, right? You hear it on the commercials. Periodontal disease is a step beyond gingivitis, okay? So gingivitis means that your gums bleed. Healthy gums don't bleed. And healthy gums, the gums are tightly attached to your teeth. So if you go for your regular dental checkups and cleanings, part of your dental exam includes x-rays. All right. And when the dentist takes those x-rays is because we need to check the bone levels. Not only are we just checking for tooth decay, but we're also trying to see how healthy are your gums and your bone. And so from there, after we do the x-rays, then the dentist will come in there or the hygienist will come in there and we're going to do a gum health screening. And so we take a probe and we're going to measure how tightly attached the gums are to your teeth. In healthy gums, the gums are tightly attached to teeth. So I really like to use this analogy. Think of it almost like a sleeve. Okay, so if you have my sleeve over here, healthy gums, the gums are tightly attached to the sleeve. And your toothbrush can only reach about 2 to 3 millimeters. Okay, so there is a space between the tooth. So my hand and my arm over here is your tooth, and your sleeve is your gum. Okay, so there's a natural space. This is called a pocket, and plaque, tartar, bacteria start to build up in that pocket, okay? And your toothbrush can really only reach about 2 to 3 millimeters to scrape off tartar and bacteria over there. Over time, if plaque and tartar and bacteria is left untreated, then the gums start to detach from the teeth and that pocket gets deeper, okay? And so when the doctor is measuring the health of the gums, we're trying to see, okay, are those pocket depths healthy or are they deeper and unhealthy, okay? And so we do this gum screening. And there are a lot of factors that affect the health of your gums. All right, and so, you know, there are a lot of conditions that affect the health of your gums, right? There's a genetic component to gum disease. If patients are dealing with other comorbidities, right? Cardiovascular disease, diabetes, patients who are pregnant and their hormones, again, there's a genetic component. Minority populations, specifically Asians, Hispanic, Black populations, Native American, we are all more at risk for gum disease. And so over time, as that plaque, tartar, bacteria start to build up below the gum line, below where your toothbrush can reach, then the gums start to detach from the teeth, okay? And so now that bacteria starts to spread to the bone and it starts eating away at the bone, okay? And our teeth are embedded in our mouth, in our jaws, so they're held in place in our mouth by the gums and the bone. So the gums and the bone are the foundation that hold everything in place. And so this is a big deal, all right? So periodontal disease essentially is advanced gum disease that is starting to eat away at the gums and the bone that hold your teeth in place, all right? And there's this big misconception. Patients will be like, oh, well, I'm just getting older, my parents had dentures, I'm going to be in dentures. So people think that as you age, you're supposed to lose your teeth. But believe it or not, the only reason people lose teeth is due to disease, all right? If you are healthy, all right, if you take care of your teeth, if you take care of the disease, then you can hold on to your teeth for the rest of your life. So this is so, so important because we want to empower, these are our family members, right? If, think about your own family and think about how many people in your family have false teeth. How many people in your family have gum recession, loose teeth, gum disease, maybe some of these other comorbidities, cardiovascular disease, diabetes, lung conditions, right? I think it's safe to say that at least one person in our Filipino family that have something like this. And so, these are chronic inflammatory diseases and they all go hand in hand. And for so long, there used to be this idea that the mouth and the diseases and the conditions that we're dealing in the mouth is completely separate from the rest of the body. but more and more studies are finding, and this is, we're talking at least over the last 20 years, but becoming more and more popularized as dentists are starting to change their approach and how they handle patient care, and dental and medical and dental insurance companies are starting to get on board, and just more research is coming out to support this. But it totally makes sense that what's going on in the mouth is related to the rest of the body. And so there is this this study came out in 2019, and this sort of really hammers the point home to me, that gum disease is related to total body health. Specifically here, we're talking about Alzheimer's disease. The bacteria that causes gum disease and the bacteria, the dental plaque, and the tartar, that gunk that builds up on your teeth, when we analyze it under a microscope, that bacteria that's found in the dental plaque and that causes this gum disease is called P. gingivalis. Okay, so makes sense. Gingivitis, P. gingivalis. Okay, so that's the bacteria that causes gum disease. They found that patients who have Alzheimer's disease, that P. gingivalis was traveling to the brain and secreting this toxic enzyme called gingipans. All right, and 96% of brain samples in the study of patients who had Alzheimer's disease or exhibited Alzheimer's symptoms, cognitive decline, they found that this enzyme was there. All right, and so it's so interesting because we hear the word plaque a lot, especially if we're talking about, all types of different types of diseases, right? So we talk about dental plaque. All right, we think about, cardiovascular disease, arterial plaque, right? And then we think about Alzheimer's disease, right? There are those myeloid, those plaques that build up in the brain, okay? And it makes sense, right? Plaque is a buildup, okay? And it makes sense that then these bacteria that's causing the gum disease is also in the brain. That's also related to the high blood pressure. Another study that really, I talk to my patients all the time, and that really hits the nail home on why it's so important that we take care of this gum disease is because, so patients who are suffering from diabetes, studies have found that patients who get their periodontal condition under control also have improved blood sugar, HbA1c levels. All right, and so that's why now more insurances are covering more dental cleanings, because they know that it's preventative, it's treatment, it's going to help the overall health. So it's really cool. And so, as a dentist, I get all the time patients, I really think that dentistry honestly is like the overlooked medical profession. Sometimes they're like, we think that bleeding gums is normal, or we think that we often neglect our dental health. But I know that patients are really quick if they're like, my blood pressure is high, I'm going to go get that checked out, right? So I think by bringing in, letting patients know that what's going on in the mouth is connected to the big picture, that really helps empower them and really creates that urgency and builds that investment for the patient to want to take control of their conditions. All right. So now that we know what periodontal disease is, you're probably asking, okay, how do we treat it? Okay. So I'm going to exit full screen so so you can see me as I do my analogies. Okay. So in order to treat periodontal disease, okay, the first line defense to treating gum disease is through this procedure called scaling and root planing, okay? Patients call it a deep cleaning because you have those deep pockets. And so myself or my hygienist will numb you so that you're comfortable, and we're going to scrape out all of the tartar and bacteria that's stuck below the gum line in that deep pocket, all right? Because plaque is soft, okay? So your toothbrush and your floss can remove the plaque easily. However, I always tell my patients that plaque is sneaky. It's almost like a game of hide and go seek. So plaque is trying to hide in hard to reach areas. And no matter how good you are, even if you have all the best tools, there's always going to be plaque, tartar, bacteria that's starting to build up in those hard to reach areas that you can't get to, that your toothbrush and your dental home care tools can't get to. And that's why it's so important that you come in at minimum every 6 months for a checkup and cleaning. Patients who have periodontal disease, not only do their bodies accumulate bacteria quicker than average, but their bodies respond to this plaque a lot more aggressively than normal, right? For all of those other reasons that I had mentioned, genetics, systemic diseases, missing teeth, having lots of dental restorations, certain medications. Those are some things that also affect the health of your gums. So we do this procedure called scaling and root planing, or we do, AKA deep cleaning. All right. And we're going to remove and break up all of those bacterial colonies. And afterwards, I always tell my patients, in an ideal world, hopefully we never have to do the deep cleaning ever again. We expect healing to occur, but just like any chronic infection, it's going to require maintenance, and it's going to require a lot of effort on your part and constant monitoring on how we can make sure that we're staying ahead of the disease. So obviously, you're only seeing your dentist every so often, right? For patients who have periodontal disease, we recommend that they're on a 3-month maintenance cycle. So they're going to be coming in every 3 months for what's called periodontal maintenance therapy. It's a specialized cleaning for patients who have periodontal disease. Again, we don't expect the pockets to be as bad, and we don't expect the buildup to be as bad as it was when they had first come in for the scaling and root planing, because we expect them to be maintaining it at home. But again, there's going to be stuff, bacteria, plaque, tartar that's building up, so that we need to clean it off. And as well, the importance of those visits is for the dentist and the hygienist to be checking in with the patient, reviewing brushing and flossing techniques, and just reviewing other tools that they might need to be able to take advantage of so they can maintain everything at home. And, from there, sometimes patients' gum disease is so aggressive that they need to see a specialist. It's a periodontist for additional treatment. But again, periodontal disease is very is linked and is associated with diabetes, hypertension, and so just like those chronic infections, it's something that you just deal with or forever. And so, but people can manage it, and that's what we do with periodontal disease. So going back to my slides. So how do we talk to our Asian patients about their gum condition? This is a really important topic because, I think especially patients, they're dentists, they're already afraid of coming to, and they're already afraid of coming to the dentist. They're afraid to hear the bad news. They're anxious about what you're going to say. They're anxious about the pain that they may have. And so it's important that we explain to them. In my practice, I make sure that we talk to our patients in a way that they understand. And that's sort of very similar to my oral health minute videos, okay? What inspired that is because I remember when I first started doing when I first started working, I was so clinical with my patients and I was losing them. I was using a lot of clinical jargon. I was just talking to them, trying to prove that I'm smart, I'm an expert. But we have to remember, we have to put ourselves in our patient's shoes, and they don't understand these clinical terms. And so if they don't understand their condition, and if they don't understand why it's important, and if they don't understand the consequences and the repercussions of this disease and what can happen if it's left untreated, then they're not going to accept the treatment, and they're going to leave, and they're never going to come back, and they're just going to continue, their health is going to continue to deteriorate. And so, number one, I would say what we can do is make sure that we're explaining things in a way that they can understand. Okay. So I'm going to share with you one of my oral health minute videos that it's fun, but really highlights what.
Did you know not all cleanings are created equally? Patients be like, I just want my regular cleaning. What my insurance cover? Free cleaning? Prophylaxis. A prophylaxis is for healthy gums without disease. It's like taking your car to the car wash when it's only 6 months old. Drive-through car wash will work just fine. See you in 6 months. If you have deep pockets, bone loss, and the dentist diagnoses you with periodontal disease, you need scaling and root planing. Why do I have a copay? A deep cleaning? Has it been a while since your last car wash? That drive-through car wash will not be enough.
You need a detail.
The dentist or the hygienist will clean off the plaque and tartar that are stuck in those deep pockets. Now that tartar is out of the picture, the gums and the teeth can reunite and be best friends again. But it doesn't stop there. If you want to keep your gums healthy, you'll still have to come in for your regular 3 to 6 month checkup. I'm Dr. Bianca Velayo, and I hope you enjoyed today's Oral Health Minute.
So, as you can see, I'm breaking things up and I'm presenting everything in a way that patients understand. I'm also really sensitive to what are patients' concerns. Here you can see that patients are concerned. Number one thing I say when I tell my patients, hey, you need scaling and root planing, you need this deep cleaning, the first thing they're going to say is, well, does my insurance cover that? That sounds expensive, And so again, we need to create the value and show them that this is different than, the basic prophylactic cleaning. A basic prophylactic cleaning is in the absence of disease. You have active disease that's eating away at the gums and the bone that hold the teeth in place. This is the number one reason adults lose teeth. If we don't get this under control, it's going to cause bone loss and loose teeth, and I tie in their other medical conditions. You review their medical history and you say, this is affecting your cardiovascular health. This is affecting your diabetes and blood sugar levels. And they understand that. Another thing that I always explain to my patients as well, that I think us as Filipinos can really use is I put them in our shoes. I say us Filipinos, right? So when I'm explaining this disease, I say us Filipinos, us Asians, we are more than 50% of Asians have periodontal disease. All of a sudden, that's making the patient feel like, okay, less ashamed, and they can relax a little bit and know that I'm on their team. We're the same, and I'm here to help you, instead of them feeling like I'm lecturing at them or I'm, making them feel bad, because unfortunately that's how patients feel. They're embarrassed. They're like, how can I have let this go? How did I not know better? And so by reassuring them and letting them know that some things are a little bit out of their control, right? Like if you're more genetically predisposed, if you are taking medications that make you more prone to inflammation, and again, if you just didn't know any better. So just tying in some of those health, other health components, I think really helps create that investment. So that's pretty much all I've got for today in summary. Okay. When it comes to periodontal disease, we know that gum health is related to the total body health. Healthy gums don't bleed. Okay. And 50% of all Asian Americans have some form of periodontal disease. And so it's so important that they get this treated by the appropriate treatment, which is called scaling and root planing. AKA deep cleaning, okay? And, it's just important for us to make sure that we are educating our Filipino patients on this and showing them that we're in this together and helping empower them so that they can take the necessary steps to get their overall health under control. So that's all I have for now, and I'm happy to open the floor up to questions.
Thank you so much, Dr. Velayo. I think my quick confession is that even as someone in healthcare, I didn't know that, gum health can be related to systemic health. It's so easy to forget the teeth, the mouth. But I love how you explained that there's so many links. That graphic that you had where it was the tooth in the middle and then it's connected to so many other things. That's super important to know, especially for Filipinos and everybody that's in healthcare. And also I love how you mentioned that when you talk to patients, which is something we tend to forget, usually it's kind of easy to lecture our patients in our heads because, they're stubborn, especially for the older population, but bringing in association to our culture and letting them feel less alone and less isolated is such, I feel like, an important practice as somebody in healthcare. And thank you so much for sharing that. I really appreciate it. You have a question from Maria. Any thoughts on the oral microbiome and chronic disease? Also, did you have a different experience when living and practicing in Boston compared to Nevada as a minority?
Sure. Cool. I will start. Any thoughts on oral microbiome and chronic disease? I mean, you can see clearly the bacteria that's living in our mouth is affected. It is 100% related to chronic disease, like we talked about cardiovascular disease, and the Alzheimer's disease, the diabetes. Again, going to even just other adverse health outcomes. We're talking about, preterm birth, erectile dysfunction, lung disease, oral cancer. So absolutely. I mean, there are so many studies that support that, and anything that's not out there, I believe it 100%. Just like even like gut biome that we were talking about, and you're seeing that. I think really everything is so interconnected. So yes, I think that, and not just even, and here I talked a lot about periodontal disease, but we're also talking, when we're talking about the oral microbiome, we cannot forget about dental decay. Right? And other dental infections like abscesses related to decay or gum disease. So, and then did I have different experience when living and practicing in Boston compared to Nevada? I mean, I think it's a little bit hard to compare because when I was in Boston, I was a student versus in Nevada, I'm a full-fledged doctors. But I will have to say one thing I really love about practicing in Las Vegas is that in Nevada, the #1 foreign population is Filipino. Filipinos. So it's really cool. And so I have a lot of Filipino patients, and they, Filipinos are super loyal to Filipinos. And so I think it really helps as a Filipino that I can explain to them. And like I said, just show them everyone in my family deals with this. I'm dealing with it too. So showing them that we're in it together, and then they really trust me, because at the end of the day, when it comes to healthcare, you can recommend as much as you want, but unless patients trust you, they're not going to do anything, and you're not going to make a difference. So I am thankful that I feel like make a more profound influence on my Filipino patients' lives, where I know perhaps if they go to other places that maybe they don't know how to talk to them or relate to them, then they're not getting the treatment done. So
I love that. And you have 2 more questions. One being, how did you decide to get into dentistry?
I decided to get into dentistry. I mean, I always wanted to when I was growing up, I always wanted to do healthcare in some sense. And my family friend was a dentist, and she was our family dentist. And I remember I was in high school, and we had to do a project where we had to do show and tell career. And so I just decided to kill 2 birds with 1 stone. I had an upcoming dental appointment, and I decided to interview her for my project. And then I'm just the type of person that as soon as I have an idea, and I dive right in, and it really manifests into a deep burning passion. And that's really what dentistry was. I mean, I sold myself when I was giving my presentation and preparing for the presentation, that I decided I'm gonna be a dentist. I love helping patients. And I love working with my hands. I think that's really cool, because as dentists, we can actively treat disease right then and there, and see a difference right away, whether it's, doing a filling, or doing the, a cleaning, and removing the bacteria. I mean, that's really cool. And, patients often feel the relief right away versus some, other, healthcare professions where it's more like a wait and see approach, and it takes longer to get to that satisfaction. But yeah, I think dentistry also is an underappreciated field. And so I just felt like it could benefit from someone who has that passion for sharing why oral health is really important. So
Definitely. And lastly, what challenges did you face as a Filipina in your career, schooling, during your journey to where you are now?
I mean, being first gen, doctor here, and I mean, my parents are college grads, but they did their schooling in the Philippines. So even, navigating through that whole process, I would just say that not knowing what the steps were, you know, like, yes, you say you want to you say you want to go to college, you say you want to become a dentist, but you know, I didn't know what all the steps were. Oh, you need to take this admissions test, you need to do this interview, you need to pad your resume and say this and that and do these activities. Like, I didn't really know all of that. And I didn't really have a lot of guidance, because even my Filipino dentist, our family friend, she had a different route, right? So she was trained in the Philippines, and then she did international dental program here in the States. So even though she's a dentist and running her own business, and she was a great resource for some things, it still wasn't the same for, you know, when I was applying, right? So I would say I really didn't know what to do. And that's why I'm really thankful, Christina, why you are doing this, is because I think it is important that we have Filipino role models who, you know, did it, who went through it, so that we can ask, because I know I couldn't be here without my guidance counselors, my mentors, and just, you know, trying to attend as many conferences like this and connect with dental students, college pre-dental students, and full-fledged doctors. And so trying to pick their brains, and so they can help guide me on really what I need to do to prepare for those next steps.
Yeah, and it's incredible because, like you said, dentistry here in America is such an underappreciated field. And especially, I don't really see a lot of Filipinos here who go into dentistry. You know, it's usually they go into nursing or medicine or things like that. So I'm glad that you joined us today and represented, you know, dentistry as a Filipina. So that's amazing. And I'm so glad you came here.
Thank you.
Well, so that about wraps up our summit. I just want to say thank you again to all our panelists who came in, took the time off from their very busy schedules to join all of us today. And of course, to everybody else who attended, I really appreciate it. Today was day 1, and tomorrow will be day 2. That will be from 4 p.m. to 8 p.m. CST. So yeah, if you guys don't have any other questions, we can wrap up. And I guess if you're attending tomorrow, I will see you tomorrow. Thank you again so much for attending. Bye, guys. Yay. Thank you. I appreciate it. Thank you too.